Okay, good morning, everybody. I would like to thank you for joining us in this international workshop for hunters organized by VACDIVA project. And I'm going to give the floor to Silvinas Ilevicius from the European Commission DG Sante. So, good morning, Silvinas.
Good morning to all, and thank you for giving me a floor. So my name is Silvinas Ilevicius, and I work for the European Commission in the Directorate for Health and Food Safety and in the unit dealing with animal health. So first of all, on behalf of European Commission, let me welcome you all to this important international workshop on African swine fever. As you might know, African swine fever presents a global risk and a significant impact on animal health and welfare, but also on food security, national and global economies, rural development, social and political behavior in many countries worldwide, and also within the EU. And as you might know, for many years, the European Commission and the European Union is engaged in many activities to prevent, control, and eradicate African swine fever. As part of these activities, the Commission has been supporting scientific developments and research on African swine fever for decades, even long ago before 2014, when Asf was first introduced into the European Union from neighboring third countries. And more recently, the support provided by the Commission to several specific research initiatives and projects amounts to 30 million euros at least. And VACDIVA is one of the projects supported by the Commission through Horizon 2020 program and coordinated by the colleagues from DG Agri. The EU contribution to this project is nearly 10 million euros, and the project aims at development of safe and effective live attenuated vaccine against African swine fever, as will be presented later today by several speakers. And definitely it is an important project, since currently there is no commercially available vaccine against African swine fever in the world. And of course, a safe and effective vaccine is required globally for the prevention, more effective control, but also for full eradication of African swine fever in the long term. And moreover, the hunters are playing a crucial role in the fight against African swine fever. Hunting as a major wild boar management practice should be a part of a solution, adapting to different epidemiological circumstances and to a global challenge of African swine fever. Therefore, I would like to thank all involved, and in particular Professor Vizcaino, for organizing today's international workshop for hunters on African swine fever and for inviting us to this important event. I wish you all an interesting and fruitful discussions today. Thank you very much.
So thank you very much, Silvinas. Now, Jose Manuel Sanchez Vizcaino, the project coordinator, will give the welcome to all of you to this workshop.
Okay, thank you very much, Raquel. Thank you very much, Dr. Silvinas, for your words and for also to join us today. I would like to give the welcome to all of you. We have a very interesting program ahead. We have so many people already with us and are still coming more. So it's very interesting that all of you can join us. We're going to make today a review. How is the situation of African swine fever around the world? As you know, it's the first time that it's affecting 5 continents. And also we're going to set for you and to introduce how is the situation at this moment of the VACDIVA projects. So I hope that you have a very interesting day. We also would like it to have as much as possible from your questions, and any questions that you have, please. And in the time of that, I hope that you can ask it to us and everybody receive the answer for any question that you have. So the idea is to review the project in general, and later we're going to have several roundtables, and each roundtable we're going to review how is the situation in the main important objective of VACDIVA that as has been mentioned previously, is going to be the safety is the first point for us. also DIVA, and also with a very efficacy. This is the vaccine that we are working already for domestic and wild boar, and I hope that you enjoy the session. So the first presentation today is going to be presented by Dr. Silvinus Elevicius. So Dr. Elevicius, please, you have again the floor to present the first presentation in relation with the situation of African swine fever in the European Union. So please, you have the floor. Thank you very much.
Thank you very much, Professor Vizcaino. And indeed, I would like to present African swine fever situation in the EU. And I hope I can control the slides. Yes, so on this slide, you see a map, you can see a map of African swine fever distribution in different administrative divisions in Asia, Europe, and Pacific and Americas since 2013. The areas in third countries are colored in orange, and in blue you will see the areas in the European Union. It's easy to spot from this map that the disease is still quite limited in the European Union, while the spread of African swine fever in other regions is quite significant. And also you will see on your right the list of countries in Asia and also in Americas which were affected by this disease. And more recently, last year, since July, in Dominican Republic, in Haiti, Asf was detected also in the Americas region. And the last country which notified African swine fever in Asia this last month was Thailand. And of course, the situation there is very worrying. And also on your left, you will see few areas colored in green, and this indicates several successful stories where African swine fever was fully eradicated from the EU. And I refer here to the eradication of Asf in Belgium and also in the Czech Republic. So this is how the disease is located in the European Union since 2014. 10 member states are currently affected, and Lithuania was the first country which notified Asf in 2014. And more recently, Italy has notified Asf in the mainland of Italy in January of this year. And you will see also that 3 countries, so the Czech Republic, Belgium, which managed to eradicate Asf from wild boar population, and also Greece, which had 1 outbreak in pigs, which was successfully eradicated in 2020. A few words on the most recent developments of Asf in the EU. So here you will see the slide on the Asf situation in Italy. This is the yellow spot on the map, which represents the infected area as defined by the EU legislation. We have a specific safeguard measure which is applied to Italy, and of course it affects and basically there is a full standstill of pigs and pig products from this area. They cannot be authorized for movements to other member states and to third countries. And also, since yesterday, we have a EU vet mission. We have a so-called EU veteran emergency team with the best experts available, which is helping our colleagues from Italy to fine-tune local strategies, how to contain and how to eradicate African swine fever from this area. And of course, just to mention that this new disease situation in Italy is related to genotype 2 of African swine fever, and of course is not related to the disease situation in Sardinia. As you might know, Asf is present in that island since 1978, but it is related to a different genotype of the disease. Now, also a few words about the Asf situation in Germany. As you might know, since several years already, we have quite a challenging situation of Asf at the bordering region with Poland in Germany, where disease is located mainly at the border, but also we have several human-related germs in Saxony, but also in Mecklenburg, Western Pomerania, in two landers of Germany. Just to give you an example of measures which are applied in Germany and in particular in newly infected areas. So those are quite similar as the ones that we've been applied by the colleagues in the Czech Republic and Belgium. We are learning from these best experiences, and of course, these measures involves the building of fences, using drones to locate wild boar, using traps, and of course implementing awareness campaigns related to ASF. So again, just to highlight that these measures are let's say copied or basically tailored to the particular situation of Germany, but also in other areas. And those are driven by the good examples that we have and best practices that we have from ASF eradication in 2 member states, in the Czech Republic and Belgium, where disease was fully eradicated within several years in wild boar, because of course these countries managed to contain the disease in a very limited areas, and then by applying different measures, it was possible to eradicate the disease completely from those spots. I will not go into the details in all the initiatives that the EU implemented since years in relation to African swine fever, but just to mention that already before ASF was introduced into the European Union, and the EU has invested a lot in the scientific development, in scientific advice, and our food safety authority, European Food Safety Authority in Parma, EFSA, has provided many scientific opinions and reports related to African swine fever. We have a good network of labs, and of course here we have to mention a EU reference laboratory for African swine fever in Spain, in Madrid, and colleagues are closely involved in this VACDIVA project as well. We are investing a lot, as I said in the beginning, on the research related to African swine fever since years. Of course, EU legislation is in place, both horizontal and also specific measures related to African swine fever. We have also EU guidelines which provide for assistance in relation to African swine fever to member states. The zoning measures, I will come back into this a bit later. And of course, we are investing a lot in the border controls audit. We are providing financial support both to the member states, but also to neighboring third countries. And we support these measures with trainings, specific training programs, public awareness tools, urgent intervention, as I said, through the EU Veteran Emergency Team. And we cooperate at international level with our trading partners in relation to global strategy of ISF control. Few words on the EU legislation. As you might know, we have a so-called animal health law, which is a horizontal framework legislation related to animal health in the EU, which is complemented by additional rules, I mean delegated and implementing acts. And this legislation applies from 21st of April last year. So these animal health rules provide for general obligations and responsibilities of different operators, professionals, and also hunters for disease prevention measures, disease eradication and control tools. It also contains provisions concerning intra-EU movements and entry into the EU measures, and also emergency measures related to different diseases. And here it is important to highlight that Article 46, which is quite relevant to scientific projects and in particular for this one of VACDIVA, that for the use of veterinary medicinal products, member states must ensure that any testing and development of veterinary medicinal products is done under controlled conditions to protect animal and public health. So this is an important article that can be found in the animal health law of the EU. In what concerns specific ASF legislation, we have several delegated, we have some horizontal legal acts like the one I've mentioned, animal health law, which is also supported by the Commission Delegated Regulation 2020-687. And in that piece of legislation, you will find measures which must be applied concerning the suspicion of outbreak, confirmation of outbreak, and etc., and how these outbreaks should be eradicated. The Commission has a possibility to apply emergency measures in cases where it is necessary. And we have a specific legislation, so-called Commission Implementing Regulation 2021-605, ASF regulation, which provides for specific measures concerning African swine fever. As I mentioned before, EU regionalization is an important element of our overall strategy in the fight with African swine fever. So we have several restricted zones defined in the EU. Restricted zone 1, which is kind of a buffer zone where disease is not yet detected. You can see it is a blue on this map on your left. Restricted zone 2, or infected zone, where ASF is detected in wild boar, and this is in pink in the map, on the map. And restricted zone 3, so-called a further restricted zone, where ASF is detected in domestic pig population. So this is in red on the map. And how we apply this regionalization is provided in several guidance documents, which are also available on the website of the European Commission. And also just to mention that this specific legislation provides for a set of prohibitions which apply to those restricted zones, to blue, pink, and red areas on the map. And basically it is prohibited to dispatch live porcine animals, but also products of animal origin and etc. from these areas, including also the meat of originated from wild boar, from wild porcine animals. And we have safe derogations where under certain conditions, the competent authority of a member state can authorize the movements outside of these zones. So these measures are defined in specific articles of that ASF regulation. And in the Annex 1 of that regulation, you can find the list of restricted zones in the EU, which are categorized, as I mentioned, based on the epidemiological situation of the disease. And of course, on the website of the Commission, you can find different tools, maps, and also interactive tool where you can see concrete restricted zones quite clearly. When we speak about the EU guidelines for African swine fever, we have so-called strategic approach for the management of African swine fever in the EU, which is in place in the EU since 2015, and it provides for guidance on many areas, but mostly on wild boar management in the context of African swine fever. So in this guidance document, you will see a certain set of recommendations related to passive surveillance, also to containment and isolation of the disease, on active patrolling and search of carcasses, which is also a very important element to reduce the environmental contamination of ASF virus, tailor-made hunting, biosecurity, trapping, prohibition of sustained feeding, awareness and cooperation. So all these elements are covered by this guidance document of the EU. And important to note that Annex 4 of this strategy provides for a concept concerning national action plans on long-term wild boar management in the context of African swine fever. So basically it means that all member states which are concerned by wild boar population in their territories, they should have in place so-called national action plans, which provides for long-term strategy on wild boar management in that particular member state. And everything again can be found on the website of the Commission in this regard. When it comes to money, since 2014, more than 230 million euros have been granted from the EU budget to support the member states and also neighboring third countries through veterinary programs and through emergency measures concerning African swine fever. And just to mention that several elements like passive surveillance and awareness campaigns are supported to all member states, even to those that are not affected by the disease, and also to our neighboring third countries, in particular in Ukraine, Moldova, or several Western Balkan countries. Also, we have a very important regional platform to discuss African swine fever and to cooperate on the measures concerning this disease with our neighboring countries. So-called standing group of experts on African swine fever in Europe under the GFTATS instrument, which is an initiative of the OIE and FAO. And since 2014, already 18 meetings have been organized, and different aspects related to African swine fever have been discussed in this important regional platform. Just to mention that following this European example, similar standing group of experts were also developed in other regions in Asia, Americas, and more recently also in Africa. And of course, we are cooperating with those standing groups closely. As I mentioned, everything we do on ASF is available on the website of the European Commission. It's useful also for hunters if you wish to look for information related to concrete restricted zones. Also, you will find important links to the handbooks of wild boar management and biosecurity. You will find these links to the guidance documents and the EU legislation. So this is a useful tool that is available for everyone that is interested. Also, we invest a lot into awareness raising campaigns, and in particular in cooperation with hunters. And since years, we had already several events, several important initiatives where we met and discussed with hunters about African swine fever. So starting from TAEX workshop in 2018, several ministerial events, high-level events, but also a more specific workshops where we discussed with the colleagues, in particular from FACE, from European Umbrella Organization for Hunting Associations, and also where CIC, the International Association, was present. And for a few final words, I would like to summarize the key messages on African swine fever to hunters that I've been highlighting and my colleagues been highlighting for several years already. So first of all, of course, we have to take into account the rising densities of wild boar population in Europe, and this presents a big challenge to control and to prevent and to eradicate ASF. So therefore, appropriate reduction of wild boar population in Europe is crucial. And therefore, as I mentioned, these national action plans provided currently in the EU guidance documents are a very important tool to agree on those national strategies in the member states and, of course, outside the EU where relevant. Passive surveillance, of course, is the most important tool for early detection of the disease. So it means that hunters should look for dead wild boar in the forest, and it could indicate the presence of African swine fever in the environment. And therefore, as soon as the disease is detected, it is possible to apply specific eradication measures, like it was done in the Czech Republic and Belgium. So therefore, this rapid response and early detection is very crucial in the eradication of the disease. Hunting biosecurity should be an everyday practice, because we know that the risks are there, and therefore hunters should ensure that biosecurity measures are in place. And for that, we have also the GFTATS handbook developed developed by the OIE and FAO and supported by the European Commission, where all these measures, biosecurity measures, are provided in that handbook. It is important to mention that specific hunting regulations and the population actions should be applied in different restricted zones. So therefore, it is important that hunters are cooperating with the competent authorities, because by certain action, it is possible to spread the disease further. So for example, if you have a newly infected zone, and if you do a massive hunting, of course, it might have counterproductive result. And therefore, we have to be very careful in specific hunting efforts in different areas. Also, just to mention again that in this specific legislation, in the Asf regulation that I've mentioned, we have several prohibitions concerning wild boar meat and wild boar movement. So just to mention that live wild boar movement by operators is prohibited in the EU because of African swine fever risks, and also the meat, fresh meat products, and any other products from wild boar from restricted zone 1, 2, and 3, the movement of those is prohibited, and only under certain condition it is possible to move such meat. For example, after the testing, and therefore, again, it is important to cooperate with the competent authorities who can advise you on specific regime for movement of such products and meat. And of course, as I mentioned, certain activities when we have ongoing epidemic should be avoided, like driven hunts, for example, in the newly infected zones where ASF is just detected. Again, just to be sure that ASF is not spread any further. And as I mentioned, minimizing environmental load is a top priority, and therefore the carcass setch and safe removal of those carcasses from the environment is important and is one of the main tool that we use in newly infected areas to ensure that the disease is not spreading any further. Of course, a regular dialogue between all involved stakeholders and tailor-made long-term strategy on wild boar population is crucial, and therefore, as I mentioned, we have this concept of national action plans where different ministries, different stakeholders can meet and discuss national priorities, national objectives and targets, and to agree on specific measures how to deal with African swine fever in the long term. And of course, cross-border cooperation and international cooperation is important. And as I mentioned, EU invests a lot in these activities as well. And let me finalize with a few conclusions that I've also presented in the recent meeting of hunting directors in Estonia in Slovenia in September 2021. So first of all, of course, we have to recognize that wild boar are really the victims of this new disease. And I recall very well from my studies in Veterinary Academy at that time that ASF was considered as exotic disease, but of course now it is present in many continents, as was mentioned, and of course we have to adapt to this particular situation. And therefore, hunting is not sustainable in the long term if African swine fever is present. This is an important element, since when you have virus present in the forest, the hunting habits and hunting itself should change to adapt to such changing environment and to specific disease situation. And previous wild boar management is not compatible and not sustainable with the current epidemiological situation in the EU. And here in particular, I'm referring to the infected zones and areas at risk, where we should aim to reduce wild boar population as much as possible. Therefore, certain practices, for example, sustained feeding of wild boar during winters should not take place. And as I said, also the hunting management should be adapted to these specific situations of the disease. And as I've also mentioned in the beginning of this event, the hunting is a major wildlife management practice, and it should be part of the solution to help to control, prevent, and eradicate African swine fever. And again, let me stress that the role of hunters in this exercise is crucial. And we, of course, welcome very much the cooperation with the veterinary authorities by hunters. Their role is crucial in passive surveillance to detect the disease in the forest, to notify authorities about any suspicion or about the possibilities related to ASF in these areas, for raising awareness campaigns between the hunting society, but also more generally for the public and for farmers, for example, for implementing biosecurity measures during the hunting, for not feeding wild boar in the forest where we have increased wild boar populations already, and of course cooperating in this overall appropriate reduction of wild boar population in the EU, because in this way the likelihood of ASF occurrence is reduced, and it's much more easier to apply specific disease control measures when you have lower population of wild boar in specific area. So this is all from my side. Thank you very much for your attention.
Thank you very much, Dr. Levitius, for these fantastic presentations about the situations and the measures that are taken under the European Union. I think it's very, very interesting. And you have already several questions that the people are asking you. So the floor is open for more questions if you want. You can take and read your own questions already. If you went to question and answer in your computer, or if you want, I can read it for you.
It's okay, I can see the questions. So
yeah, you have 4 questions already.
Yeah, I can reply those immediately. So
thank you very much, Doctor.
The first question is related to the Serbian situation. So yes, in fact, the focus was on the situation in the European Union, and the overall map in the beginning was more related to different continents such as Asia, Americas, and Pacific. But for Serbia, we have also specific updates presented in this standing group of experts under the GFTATS. And if you go to the GFTATS website, I can maybe later provide the link in the chat. You will see the updates of Serbia on this epidemiological situation of African swine fever. But just to assure you that we have regular exchanges with the neighboring countries in Europe, where we discuss ASF, particular ASF situations in those countries. So I will provide a link in the chat at a later stage for Serbia. Now, the next question relates to Sardinia. And the question is why genotype 1 in Sardinia has not produced any spillover in Italy and Europe despite the huge movement of people, and while genotype 2 produce continuously outbreaks. Thank you for this question. So again, let me stress that since years the EU had specific approaches and specific legislation related to African swine fever. And of course, in case of Sardinia, all the movements of meat of live animals was also prohibited. And of course, this influenced that the disease has not spread any further, because it was not possible to move any live porcine animal or any meat which could have presented the risk for African swine fever. So therefore, these measures, of course, influence that the disease was contained, and of course this is a very isolated events in Sardinia, And when you look into the situation of genotype 2 in the EU, of course, here we have to admit that wild boar are playing an important role, and the populations, as I said, are very dense. So even the natural movements of African swine fever through wild boar can happen 1 to 2 kilometers per month. And of course, we know that it's very difficult to ensure that this is not spreading. But of course, there are different measures also to ensure that the disease is not spread by human. We invest a lot in the awareness campaigns, but of course, specific challenges exist. The next question relates to Asf Situation in Italy. How Asf was transmitted to Italy. Of course, if we speak about this mainland situation in the mainland of Italy, we don't have yet any concrete information from our colleagues from Italy on this. Epidemiological investigation is ongoing. As I've mentioned, we've also have a EU veterinary emergency team on the spot currently, because the mission has started yesterday, and they are looking into this specific situation. But of course, apparently this is human-related spread, because the closest ASF restricted zone or infected zone is at 800 kilometers or more distance. And of course, it is related to the human factor. As you could see, we have several highways in this area. We have a seaport, airport. So of course, we cannot exclude any possibilities related to the human-mediated spread in this area. What about ASF in Macedonia? The next question. Thank you. Indeed, very recently, North Macedonia announced the first outbreak of African swine fever in pigs, and this is the first occurrence of ASF in that country. We are cooperating with North Macedonian colleagues in this situation. We've been requested for specific support again through a EU veterinary emergency team, which took place in North Macedonia last week. And of course, we are helping also through several financial measures. Again, as I mentioned, in relation to passive surveillance and awareness campaigns. So in this regard, I can also provide you for North Macedonia, we don't have any presentation yet, because these events are quite recent, but at the end of February, we will be having standing group of experts under the GFTATS, where colleagues of North Macedonia will also report about the Asf situation in their country. And after this meeting, you will be able to find more information and the specific presentation on the website. There is one question in German. I'm sorry, I'm not good in this, so I will skip this one. The next question relates to wild boar hunting in Estonia, Latvia, and Lithuania. So indeed, the hunting in areas which are affected by African swine fever for a long time is not restricted. It's up at least at the EU level. We don't have any specific prohibitions for hunting in the areas which are affected by African swine fever for a long time. And of course, this is a question to local administrations, to local authorities. But to my knowledge, the hunting is allowed. You can move meat after testing of wild boar by PCR to be sure that African swine fever is not present in those wild boar. But again, this is a question to the colleagues from those countries. And now the next question relates to a difficult situation of African swine fever in Poland. Yes, sanitary shooting of wild boar. Yes. So indeed, I agree that the African swine fever situation in Poland is challenging, because since years there were several hotspots in Poland, both related to wild boar and also to domestic pigs. And of course, we are cooperating with the Polish authorities concerning this disease. And of course, we are very much concerned about several jumps which occurred some time ago also to this western part of Poland, where disease jumped around 250, 300 kilometers from the infected zones. And of course, this creates additional challenges. And of course, again, these annual hunting plans, as mentioned in the question, or we are referring to national action plans on wild boar management. This is left to the member states. In the guidance documents provided by the EU, we have specific recommendations, but of course these plans and these measures should be adopted and should be adapted and should be tailor-made to the specific situation. And of course the local authorities are the best equipped to fine-tune these measures on the spot and on the field. Just to mention that for Poland, we are also organizing a EU veteran emergency team in due time, and they will be discussing the current ASF situation in that country. Thank you. Now the question relates to the slaughterhouses in specific area. I'm sorry, I cannot reply on this one. I would have to look into this specific situation and to understand what is exactly the question. And now the last question is about the movement, about the hunting, I understand, of different species, not wild boar, but other species like red deer in the infected areas. So indeed, this is a good question. Thank you for this. When we speak about newly infected areas and newly infected zones, it's very important to restrict the hunting as much as possible, again, so not to transmit the disease any further. And from the previous experiences that we have from the Czech Republic, from Belgium, we know that hunting restrictions were in place since the beginning for a certain period of time, and it was covering not only wild boar but other species in more general way. Because again, it's the idea is to ensure that African swine fever virus is not moved with hunters from that specific area. And not only hunting, but also the forest works, for example, or even the attendance by public in the forest was prohibited in several places for a certain period of time. But again, these specific measures depend on the specific situation, and the member states and the competent authorities are the best place to check these concrete restrictions. From our side, we recommend in the EU guidance documents that the hunting is restricted in the newly infected zones until we have this increased curve of epidemic, and until we have the epidemic ongoing. And of course, at a later stage, when most of the wild boar population in that area is killed by the virus, of course, there are another measures to be taken on the spot. And this, again, you can find in the EU guidance document in the concrete table. Depending on the epidemiological situation of a disease, you will find the list of measures which should be applied in those specific areas. And the next question relates to the successful eradication of ASF in the Czech Republic. So yes, indeed, we are taking all these best experiences that we have, not only from the Czech Republic, but also from Belgium. And specific measures are fine-tuned and also described in the EU guidance document, in the strategic approach for African swine fever. The experts from the Czech Republic and from Belgium are also involved in this EU veterinary emergency team, and they are going to other member states to assist and to help colleagues from other administrations to fine-tune local measures against African swine fever. And of course, we use this experience as much as possible. The next question is about the passive surveillance versus the active surveillance. So indeed, this is a combination of measures. As I mentioned, passive surveillance is the best tool to detect ASF quickly. When we speak about the forest, when you see that many wild boar are dead and you test them, there is a high probability that African swine fever is present. And of course, the passive surveillance is the best instrument to detect ASF quickly. But active surveillance is also used by the member states in areas where disease is present for longer time to see how the disease is moving, how it is behaving, and of course, it helps to define exactly the areas which are infected by African swine fever, and for certain scientific studies, and of course this is used as an instrument. And you will see in the EU guidance document that both passive surveillance and active surveillance is recommended under specific situations and under specific circumstances. Now the next question relates to the transport from by Polish transporters in, I understand, German territories. So, of course, the general rules concerning prevention of diseases, not only African swine fever, but more generally about different diseases, are present. We have specific provisions where member states must ensure that that transports are properly cleaned, disinfected, and the means of transport do not present the risk for the transmission of the diseases. We have no specific provisions concerning the, let's say, control of means of transport for in case of African swine fever. But again, this is related to the general provisions for not transmitting any disease through means of transport. And in case of African swine fever, when you have, for example, outbreaks of ASF in domestic pigs in particular, you have certain requirements concerning protection and surveillance zones, which have to be established by the competent authorities. And then specific provisions apply and more strict regime is applied. And then, of course, certain movements are prohibited, and of course, the risk is reduced as much as possible. And again, just to reiterate that since ASF was present in the EU, we have no, let's say, no proofs, or we have no information that the disease was spread through the legal trade, through legal movements. Of course, we have certain germs of a disease, but it was not confirmed through the epidemiological investigation that the legal trade was cause of these outbreaks. So again, the measures that we have in the EU, these risk mitigating measures, are proved to be efficient. And of course, with the cooperation of member states, we are taking any possible action to prevent from ASF spread in the EU. So I think this is all from my side. I see no further questions. So yes, thank you very much.
Yes, thank you very much, Dr. Elevicius. Yes, you don't have more questions so far. So thank you very much for the presentations and to answer all these and give it all these informations to our audience. So we're going to go to the next presentations, and later after mine, if you also have any other questions, we can answer to all of them. So we're going now to present the global ASF situation after the presentation of Dr. Elevicius about the European Union. We're going to see how is the situation around the world, as you see already in 5 continents. And I have to tell you that I started working in African swine fever in 1978. So that is a long time, as you know. But this is the worst situations I never saw in all this year. Already it's affecting the 5 continents. It's the first time. And we have more than 50 countries already affected with different epidemiological scenarios. So that means that the situation is not the same in one part or another. And the last area affected has been, as you know, Dominican Republic and Haiti. And as you also know, the situation, everything started in Africa in 1921 when African swine fever has been described festival. I'm going to give you an overview of the whole situation. As you know, in Africa, as I told you, is where African swine fever was first described. We have 2 different epidemiological situations that are quite different. The worst situation is in East and South Africa, and I'm going to explain you in a few seconds why. Here is a continued infections between domestic wildlife and also ticks. And here is the presence of all the different genotypes that we described already in African swine fever. All of these genotypes are present in here. The West Africa, it's relatively more simple. I think that could be easily eradicated here, but of course the reinfection from this side make quite a lot of trouble sometimes. I'm going to summarize why it's so complicated here in the East and South Africa. So the situations, as I mentioned, has been in this area where in Kenya, when has been reported for first time in the world, African swine fever in 1921. They discovered the disease because they introduced from Europe regular pig, domestic pig, and this domestic pig died easily with a disease that was not classical swine fever, was a little more severe, with a lot of more acute lesion, etc. So finally, they described this anew, by Montgomery, described this a new disease, is an African swine fever. And as I told you, all the different genotypes, so that means all the different type of virus that we can classify so much are present in this area. Why this area is so complicated? Because we have 2 species here, this Facochero and the bush pigs. These animals are tolerant to African swine fever. They have infection of the virus, but never reach title of virus higher than 10^2. So that means that the animal doesn't die with this disease. They don't die. They are carriers because they have the virus. So the ticks take the opportunity, and when they bite these 2 animals, they can increase the title of 10^2 to 10^7 and reinfect it to domestic and to wildlife again. So this herbatic and domestic cycle is the biggest problem to finish with ASF in this part of the world. And this is fantastic because this animal, we have to protect these beautiful animals. So here is one of the situations why there are so much virus circulating in this area and this herbatic and domestical cycle. So in Asia is where we have another big problem at this moment. 17 countries of Asia are already affected until February 5th of 2022. So you can see that very little are green already. And the situation is quite complicated there for many reasons. One is because according with our colleagues, our Chinese colleagues, they start to communicate it, several situations that complicate very much the control of ASF there. The first things that they communicated was to found new attenuated African swine fever virus at the beginning from genotype 2, but more recently also for genotype 1. Genotype 1 has been in the 60s, 70s in Europe, but later has been in silence for all this time. And they appear now in China again, together with the genotype 2. So they also found illegal or legal vaccines already circulating. So they are producing a new disease, is a more attenuated disease, and a large amount of virus is circulating at this moment in Asia. So as you can see, all these countries are affected already. And if you see the last situations that really was very complicated is when they describe it, that they found genotype 1. As I told you, genotype 1 is a virus that has been for a long time only in the laboratories. And so I don't know really how they appear now there, but that is the situation at this moment. It's appear in a very important area of China where it's also a spread to other at this moment. So there is already the situations of 2 different viruses with different clinical picture and with different symptomatology. All this is related with what we know is already illegal vaccines. Some of them even are used, this illegal vaccine. They put the label of this very prestigious laboratory in China, that is the Harbin Veterinary Research Institute, and they already tell that there's nothing related with them. We know that, but they are using that, as well as they said that they have smuggled important vaccine from Spain and from Vietnam. The people that know about this situation, they said that they use the Spanish and Vietnam because they know that in both places we are working on new vaccines or whatever, and these are probably the reasons why they are using that. All this information is absolutely illegal, but the problem is that even these guys offer, as you can see down, they offer to buy this vaccine in internet. So this is the situation so that are creating a lot of trouble. So at this moment, we summarize for you which are the problems that we observed already in China and the risk factor that we found. The first one is 2 that are very much related by the traditions of the Chinese people, and is use the blood together with vegetables to feed animals. They also use a lot the sweet feeding from houses, restaurants, cafeterias, etc. They also have infected carrier. Sometimes has been detected infected carrier going directly to the slaughterhouse. Also, infect vehicles is very frequently. Unidentified pig transportations in the road, low biosecurity in some parts of the farms, especially the family and the backyard farms, with a very, very low biosecurity, in contrast with a fantastic other farms that have a high biosecurity industrial farm that are working very well. No or poor compensation. This is a very important issue. As you know, when you don't compensate the farmers when they have this type of diseases, normally the hunters that are infected, they don't help too much to really inform about these diseases. They usually try to sell the product, to sell the meat, to not lose too much money. This is a very weak problem, to not compensate the farmer. Also at this moment, as I mentioned before, attenuated strains are also circulating. And also one thing that surprised us very much is that they have a very high population of wild boar, more than we have in Europe, and they still don't evaluate it as a risk factor. To give you an idea, this is how we calculated in our wood, how we predict the African swine fever risk areas of wild boar. And as you can see, it's a lot more that are present in Europe. And in Europe, as you know, we have quite a lot of problems. They only reported 6 cases since 2018. And we think that probably they still don't found the role that these animals can play in all this spread that they have. And now with the combination of both attenuated and virulent strain is making a real problem. So what we think that the hunter can help the situation, this is what today I offered you in our agenda. We would like it to see if we can make some of these questions for you. Why we think you can help it as has been informed previously, the hunters have a very important role in helping all of us in fight against ASF. And so we think that these points could be very interesting. And this is part of the information that we're going to transmit today to all of you, to know the virus and its main transmission mechanism. The virus, African swine fever, as you're going to see in a few minutes, use a very fantastic mechanism based on several things in the resistance of the virus, as well as in different way to transmit that virus. The second question that I would like to tell with you today is be aware of the current risk of the disease. It's very important that all of you that are going to the field and are moving sometime to different countries know how is the situation of the disease at this moment around the world. The third point is how to help to not express the virus when you are hunting. What kind of measures, what kind of biosecurity you should take when you are hunting in Europe or outside of Europe. The fourth point is to inform about the wild boar's carcase. How to detect a carcase that could be positive to ASF, and how to communicate to the authorities in the country wherever you are. This is a very, very important issue. Dr. Elizabeth also mentioned that point. This is a very important points that we would like it to have from you. We know that you are helping us very much in this point. So the fifth point is to keep informed about the disease situation if you are hunting out. This is also very important. You have to know situations that happen outside of the European Union, and also what are the measures on biosecurity that you should take it. And finally, as we did before in the previous presentation, we would like to ask all of you all kind of questions about the situation in the European Union VACDIVA project. So just to give you a few ideas of the virus, why this virus is so complicated and why this virus is taking us so many years to really obtain a vaccine, and still we are working hard to do it, is for many reasons. The first one is a very complex virus. This virus have around 117 genes. You can imagine how big it is, how complex and how big. Just to give you an idea, most of the diseases that has been creating trouble in swines, they have 10, 15 or less genes. We are talking about a very, very complex virus that still is not well known. So we try to know every day more and more, but it still is not well known. Also, they have a genetic variability. So that means that there is not a unique virus. We don't have a single proteins that can be neutralizing the entrance of the virus if we produce antibodies or whatever. There is no neutralizing antibodies really clear that can stop the introduction of the virus into the macrophage or the cells that they infected. The other thing is, because of that, because we don't have these neutralizing antibodies in vitro, we cannot evaluate it. So we have to do all the cross protections because there are many variability. We have to do all of this, and pig trial is needed. Pig trial and wild boar trial. So we have to testing everything in vivo animals. So they take a lot of time, a lot of resources, and it's complicated, a lot of more that. And finally, this is very important. The lack of vaccine is really a big problem, and we have several prototypes that are under evaluations, and we're going also to summarize for you in this presentation how is already the situation of our candidate. So let's back to the transmissions. I want to point to attention to highlight 2 points, and is why the virus is so resistant and how the virus is moving all over. So the first thing is, from the historical point of view, most of the outbreak, and even today, the most important outbreak of ASF is coming because of the contamination of meat or meat products from swine, meat products, that they keep the virus for a long period of time, very long period of time. So the salami, so, several products and meat of pigs can keep the virus for a long period of time, and they sometimes are arriving by boat, especially more the boats that have containers, not the transatlantic. Normally transatlantic, like the fly companies, they have a very restrict method to treat the garbage that they use on the boat or on the plane. But the private plane, the small plane, and the containers boat don't have that control in most of the places. So this is the way how the virus is spreading most. This virus is eaten by wild boar or backyard farms, and this is how this meat contaminated the wildlife, and later the wildlife, the domestic, or the domestic to the wildlife. This is the situation. So the virus keep very strong and for long period of time in feces, in blood, and if you have shoes or you just move with the shoes that are infected, you're going to contaminate a lot. So be careful with that. This is the very important thing. So summarize: food produced with meat, infected meat from pigs or wild boar. Also blood. The blood is very important. And only just to give you an idea, 1 drop of blood have more than 3 million copies of virus. Feces, and this is very important. You have to be terribly important with the shoes and with all the clothes if you are doing or you are visiting farms or you are hunting. This is very, very important. The second things that I want also to point out, of course, blood, as I told you, the most important. Also the flies. The flies in summer, they can transport the virus in the legs. So in summer, be careful. If it's flies and it's blood around or feces, they can transport the virus. And this is very important. Be careful with shoes, be careful with clothes, be careful with flies. So the virus is resisting a lot. As you can see, 18 months if it's in blood for 4 degrees centigrade. 200 microliters, I told you, more than 3,000 copies is present in flies and other animals in the carcass, can keep for long period of time. So this is very, very important to keep in mind. And of course in meat. So you can see in meat, they can be for 110 days if the meat is conserved at 4 degrees. More than 1,000 is minus 20. In one pig pen, if it's not clean and disinfected, they can be the virus active for 1 month. In blood, they can be for 18 months, even at 4 degrees. So that is very, very important to keep in your mind. We have several ways of inactivation. For example, the meat can be inactivated at different temperature. You see 50, 60 degrees or 70, between 60 to 20 minutes. So we can inactivate that. In particular, I tell the people very much, especially the people that are giving food from cafeteria or houses, and they want to feed the animals, please treat it, heating that, and will be much, much better. So also you have to carefully, because already the animals can be infected and they usually have low virus, but enough. And the most important, enough to infect other, but the most important is they are moving. So the virus can be moved. And this is one of the biggest problems in the control and eradication of ASF, as has been previously described. How this virus can arrive to the domestic. So normally they came by swill feeding and backyard. This is the more frequently entrance and new areas. So places that use on the backyard, the swill feeding, or swill feeding that they leave it in the areas where the people are resting or the tourists. So this kind of, the salamis, the sandwiches, everything that they left in the garbage in the picnic area, and the wild boar are going to eat that. So they are infected, they transmitted themselves, but they also can transmit to domestic directly or indirectly. And also in the backyard farm when they are fed with this garbage, with this swill feeding. So this is very important. This is the introduction. We have introduction mainly by wild boar because they eat that in the picnic areas mainly, and later also by the backyard that they use swill feeding from cafeterias, from garbage areas, etc. And this backyard amplify the virus, and later they contact in one way or another with the industrial farm. This is the mechanism that we have to protect very much, because this is the way how ASF is spread around the world. The disease is also have different clinical signs and lesions. I'm going just to show you some in case that you can see it. Animals have, with the acute form, they have fever, anorexia, skin hemorrhagic, breathing problem, digestive problem, and incoordinations in both in wild boar and in domestic. And the lesions that you can, if you open at one, you can see how you have lymph nodes that normally very congestive, even hemorrhagic. You can also have the pneumonia. This is one of the things that confuse, for example, a lot of colleagues of us in Dominican Republic, that they thought there was not ASF, but that is an important point to detect it. Also splenomegalia. So the spleen is large, as you can see, and very dark, very congestive. Also, you can have hydrothorax. You can see hydrothorax. You can have hydrothorax with less color, less blood color, but it's also hydrothorax and here. And you also can hydropericardia. So this is where they cover the heart. You're also going to see liquid. And now that I give you all this information about the lesions, I would like to move a little in the vaccine review, just to enter in VACDIVA a little better. So I'm going to tell you that since 1921, that the African swine fever has been described to 2022, really has been making a lot of effort to have vaccine from the very beginning. And the summary of all these centuries, I'm going to summarize for you here. Inactivated vaccine, we know that doesn't work at all. They don't induce immunity, not induce immune response that can induce protection. The subunit vaccine of the DNA vaccine with little sequencing or proteins of the virus have a very weak immune response or not protection at all. So they are not working either. So the best results in all these centuries, and the best results that most of us are working is with attenuated vaccine. Attenuated vaccine gives us protections between 90 to 100%. So most of the effort in the last years, in the last century, that we are performing to obtain a vaccine is based in attenuated vaccines. It can be attenuated by naturally, or can be attenuated by the election of several genes. But these are the candidates that are giving more results. I'm going to give you a little more information of VACDIVA. What's happened with this attenuated vaccine? Which are the key point in this attenuated vaccine? That is important to have a good equilibrium between the safety, the safety and efficacy. The safety and efficacy. Because attenuated usually have a very good efficacy, but we have to be very carefully and be sure that safety is 100. That is why in our project, we first of all have as the first requirement safety. The second requirement of us is DIVA, so that we can differentiate animals vaccinated of animal infected, and the third one is efficacy. So this is very important to balance in this attenuated vaccine. I'm going to tell you a little more about these key points. So I'm going now to introduce you very frequently the project, the European VACDIVA project. This has been approved by the European Union in October 2019. We started, and our project was presented 3 different vaccine candidates to protect animals, domestic and wild boar, as I told you, with this idea: safe, effective, and DIVA vaccine. So this is our 3 important pillars of the project. And it's already composed, but we make a consortium. In this consortium, we have all the European laboratories that has been related with African swine fever in the past and more recently as well. Most of them are in our projects. We are 13 partners with 2 industrial companies So we are very lucky to have two industrial companies, one to produce the vaccine that is MSD, and other that is related with the diagnosis with the DIVA diagnosis test that is in Genasa. So these two companies are always with us and also in our consortium. But we also have in the consortium other countries from outside of the European Union. We have as a partner Russian colleagues from Ariad. Ariad is one of the reference laboratory for ASF in Russia. We work very, very close with these colleagues. Also, we work with the Chinese on the Chinese Academy of Agriculture, mainly most of them, and also in CAHED, and also with the International Livestock Research Institute, ILRI, in Kenya. So these are the three outside of the European Union countries that are also collaborating and are member of our consortium. What are the objectives? The objective of our consortium to provide a safe, DIVA, and effective vaccine. This is the most important for us, for wild boar and domestic. We're going to have more information in the roundtable 1. So I'm going to give you a little overview now, but later we're going to have a specific roundtable for these important objectives. In the second objectives, we have to develop a test, a DIVA test, to allow us to monitoring and to differentiate infected animal or vaccinated animal. So we're going also to, I'm going to give you now information about that, but later we also going to have a deeper information in the roundtable 2. And the third point of this objective was to study eradication strategies with vaccinations in the different world scenarios. So we are working in the different world scenario, evaluating the scenario from the epidemiological point of view, detected the weak point that this scenario have, and how a potential vaccine could be used in the best way. We also have in the project as one of our objectives once that these prototypes are safe, totally stable, etc., and totally proof and experimental animals to try to do a pilot vaccine in wild boar, as well as in Africa, in the bush pigs and in the warthog. Because if we can control the bush pig and the facochero, we're going to finish with the problem in Africa. And as you probably can live during this period of time with COVID, when the disease is present in one place, because of all our connection, all this interrelationship that we have already in the world, we are going to be always able to be infected again. Don't forget that this situation that we have already with the 5 continents came out of Africa is the 3rd time that this virus went out of Africa. And this is the situation that we have today. So this is the 3rd objective that we are also working in VACDIVA. So these are our candidate. Our candidate was from natural attenuated strain from genotype 2 and from genotype 1 that has been adapted to cell line culture and some of them. Other are ongoing. And also one genotype 2 that is adapted by cell culture. So these are our 3 prototypes. So, and these prototypes, I'm going to give you results that we have already. We also have in the project the production of the Lesion mutants. So that means in case that we needed not only the natural attenuation, but also for DIVA or for much better attenuation to have the Lesions, we have also in the project the Lesions mutant made directly from these 2 candidates. So from these 2 candidates, we already are working in the Lesion mutants, and we have already 6 of them in vivo studies in domestic and wild boar that is ongoing. I'm going to talk a little about that. What we are working, how our candidates have to pass. We are evaluating the shedding study of the vaccine. We also evaluate the cross protection. This is very important issue. Of course, the safety and many different conditions, pregnant animal, sick animal with other diseases, etc. to provoke, to obtain a sterile immunity. All these projects are already running, some of them ongoing already, some already in the past done, and I'm going to give you some results of that. So all of these studies, all of these prototypes are evaluated in domestic and in wild boar, as I told you. And in domestic animal are evaluated in animal trial in Perugia in Italy, where the protection until now described is 100%. And also here in Spain, in the DIVA laboratory, where also in domestic they obtain between 90, 80 and 100 protection. Here in Spain, also in the UCM, we have around 100% protection in wild boar. So the protection at this moment in our prototypes is relatively high. We can even reduce that if it's necessary to touch some of the things, but so far we are happy with the protection that we have in our candidate. These studies this is in domestic, so evaluation of safety and efficacy, formulation of which doses, this is also in wild boar the same, and safety. Safety, as I told you, very important for all of us, as well as the genetic stability. So in the wild boar, the immunization is going to be orally because we cannot do by any kind of injection, have to be orally. So we also prepare bait. We evaluated the baits and different environments in warming countries like Spain and Hungary, that is colder, also in farms and also in hunting states. So we are working in the field with this bait to see if the animals like it, if they eat, etc. And this is how we use this bait for the immunization of the vaccine. This is already one of the pictures that you can see the immunization of the wild boar by orally immunization. In the domestic, it's going to be by injections, and there are different routes that we are evaluating. Here, we have to do orally, as you can imagine. So which are the results that we have so far? We start with 92. Probably you remember one of our previous publications. We have with a protection of 92. Or we already found a beautiful dilution, a beautiful doses, and we are already in 100% and with no side effect at all. The problems that we have with the attenuation, the natural attenuation prototypes, is that any of them has good DIVA test. Why? Because the mutations that these prototypes have is not enough to have a good DIVA test. So what we are doing now, this is why has been, as I told you in the project already we are already using mutant that is already ongoing to make it, to release some genes that are not important for the protection and it's not important from the replications, but produce a protein that if it's not in the vaccine, we can differentiate the vaccinated animal that infected animals. That's the reasons why we have to move now at this situation. The reason is here. I put you an example. This is one of the prototypes that we are using with 100% protection and wild boar. But we was trying to do with the mutation that this prototype have already to have differences protein, but we don't find serological difference. So not possible to have the DIVA, and that is why we move to the mutants that is going to give us a very safe DIVA for our vaccine. So this is what these are already in my laboratory, just here, a very few meters from here. We are moving already to evaluating these mutants in the wild boar to have not only the protection that we already mentioned, but also the safety and the DIVA facilities. So this is, I'm going to put you just a little video that you can see how our animals are. We have a continued monitoring of the animals in the boxes. We have all the studies in vivo. We are all doing absolutely 24 hours a day. They are recording to see how they are feeling, how all the parameters are evaluated. And so this is how we work with the wild boar here. I'm going to show you. You can see how our animals are. And I also want to show you how we evaluating shedding. So the shedding, the shedding is evaluating not only among wild boar, but also domestic and wild boar. So we put areas where they can contact a lot with the wild boar. We monitoring how much contact are. Sometimes it's a lot, 2,000, 3,000. So it's unbelievable the contact they have, just to see if there are any shedding between the vaccinated animal and the regular pigs. This is the other ones that I want to show you. So we're going to move. This is a video, but let me just put the video so you can see. They are really nice contact. Okay, I'm going to move to the next slide. They want to show you. Okay, let's go to the next slide. This also, we're going to trade this point in the round table. This is how our company, MSD, is preparing everything for the manufacturing. So how we're going to produce in larger scale the vaccine. We are evaluating different factors, if it's necessary to produce the vaccine in level 2 or biosecurity or just level 3. We're going to talk about that, and also we are evaluating if the vaccine is better freeze it or dry it. So all these things are going also to present it to you in the round table with more details. So the last round table, the third round table, is dedicated to one of the objectives of VACDIVA, that, as I told you, is to study all the immunological models that are already running. And also we would like it, once that we have the product totally safe with all the requirements that the official authorities from the country and from the European Union, they're going to supply us all these requirements. So once that we finish all these studies, we would like it to do one small pilot vaccinations in the wild boar and also in Kenya with the wild swine. So this is what already is in the program. Of course, this is still very far away because, as I mentioned to you, we are still working a lot in safety and safety and safety. So once that we start to have all these results, we're going to start in conversations with our colleagues of the European Union and, of course, of Brussels, of DG Santé, and also in Africa. In Africa, we have been already in contact with our colleagues of ILRI, because the infection of this wildlife will be very important if we can protect it. That will be fantastic to stop this cycle of viral replication. And we also are evaluating from the epidemiological point of view other possibilities. So the ones that we have a little more in discussion of, already is the possible use of our vaccine in the ILRI facilities, not outside the ILRI facilities in Kenya. They have facilities for these animals, but are not our freedom facilities, are in the containment. So they are already working on all these make it the possibility to use our vaccine here once that all the studies of security, requirement, etc., by the EMA, etc., is totally finished. And one of the things that I have a very beautiful wish, and is that the vaccine can control the infection in these two beautiful animals and stop the production, the continuous production of virus and virus diversity, virus different mutations. So this is already working with the people. We are just starting the conversations. And the advantage of that is that, as I told you, these two animals are the ones that are creating a lot of trouble in Africa. So how is the summary of the situation? Just to keep you in mind, the genetic stability in vitro and in vivo of our prototype vaccine are partially done in vitro, but in vivo is ongoing, and it's going to keep on going for quite a long period of time still. Adaptation of the vaccine prototype to tissue culture is partially done already with some of the prototypes. Others are still ongoing. To find the best doses for domestic and for wild boar for immunization of wild boar and domestic is already done, but we are now doing the same doses with the mutants that I told you we are already working with the mutants. In wild boar immunization with bait is done. We know already that the wild boar accepted the bait very well. They eat it well. They immunize orally, but we are now starting. Only 1 week ago, we started in wild boar here with the mutants to see if the mutant also work the same. The attenuated, the original attenuated. Overdoses immunization in wild boar, we did already several studies to evaluate which one is the best, but we always work in the worst, the higher and the lower, but with the mutants, we are already repeating the same. With the mutants, the duration of immunity in domestic and wild boar is ongoing, so we're going to need a little more time. Immunization in domestic pig with larger number of animals is another thing that we are already ongoing. DIVA adaptations are partially done because we know that already we was very poor DIVA, and this is why we are working already in a much better DIVA with the mutants. The bait conservation in different scenarios has been already finished in the warmest country and is ongoing in the colder countries. And the cross protection means that the vaccine, that our vaccine can, we want to know how protection is induced at the different virus variabilities that the ASF have. If they protect totally the whole population of viruses or not, or regional population, etc. This is what we are going to do now with the mutants as well. And most information, as I told you, more detailed information you're going to receive and the different roundtable that we're going to have later on. So that's all what I want to tell you for summary, telling you that our dream is to change the color that we have already with full of African swine fever and change the color for a much better green color, thanks to the VACDIVA vaccination, if we can help with that. Thank you very much for your attention. Thank you very much for coming with us today. And I am open for any questions that I already see that you have. Here are 3 questions. Thank you very much for your attention. Okay, the first question is how much virus is needed to create infection? It's depending of the virus. The doses of the virus are variables, but to have an infection, you don't need too much higher doses. You can have, with a very nice dilutions, 10 to 1, even 10 to 2 for sure, infection. To create an infection animal is very, they replicated very quickly, and macrophages, leukocytes, and the virus is, you don't need high doses to infect animals. Believe me, very, very low doses are enough to infect it. The second question is from Andrei Gogen. Thank you very much, Andrei. How to assess the protection immune response to ASF vaccination? That is make sense to return to methods for determinate activities of immune response and cell level macrophages. Okay, Andrei, this is a very, very interesting question. As you know, the deep mechanism of protection of African swine fever is still not totally clear. We know that we need antibodies for the protections. When we know that, for example, when one vaccine prototype or one virus prototype is not inducing a good immune response, a good humoral immune response, is going to be no protection. But even that, as you know, the neutralization is not clear, but we know that. But in the internal, in the immunological point of view, we know the cytotoxicity mechanism are very important. ADCC mechanism, that means cytotoxicity binding with antibodies, are also important. We would like it to, one of the things that we are doing already, and thanks to all the materials that we are generating, is to know more about the deep immunology, deep how this mechanism really work, and we are provided with new monoclonal antibodies that we thinking it's going to be in the next month. We're going to have a lot of more experiments and a lot of more studies with that, and we hope that by the end of the VACDIVA projects, we're going to know a lot of more about the deep mechanism of ASF protection. How to assess population protective immune of a vaccine in domestic pig and wild boar. How to assess the population. Okay, in the wild boar, we have to do it orally. So what we have already is we are evaluating in the different epidemiological scenarios, which are the best areas to vaccinate it. So the idea is that to vaccinate it and once with one system that not only the adults animal can eat the bait, also the piglets can do it. So we are working with this system to be sure that we can vaccinate it by areas in both animals, the adult and the piglets. And also we want to repeat vaccination in the areas if we, control how to replace, how to put more bait in these areas. So this is something that we are already under study to really design a good mechanism of vaccinations. Once again, I want to tell, when we have all the requirements by the EMA, by the European Medicament Agency, and by the DG Santé approved. So we are working to have everything ready for that, to ask for the permission. What is the situation of a spread natural of laboratory attenuated strain in the world, in particular in China? Well, according with our colleagues, we are in permanent contact with China as well as with other countries around the world. We are permanent control. And what we know is that this vaccine that they have that are really not good vaccine. Honestly, they are doing illegal vaccine. They are taking the virus and I don't know what they are doing with there, but they are spreading. So we know that in the area where our Chinese colleague detected at the beginning, this attenuated vaccine is spreading. So that means that the attenuated vaccine that they are using are spreading. We know that in China. But in the experiments that we are doing in our laboratory, as I told you in the movie, we are doing what's happened with one animal vaccinated, how much they spread, they really spread the virus, not, etc. We are doing all these studies, as I told you, put in contact wild boar vaccinated with wild boar not vaccinated, and wild boar vaccinated or with domestic or domestic with domestic. So this is how we are evaluating, and we are doing a beautiful result so far. Very interesting. So the next question is, don't move it. It is currently possible to roughly estimate the time frame in which you expect the vaccination will be available. That's a beautiful question, Diana. I really appreciate that. We was running beautiful at the beginning, and we think we did a lot, but I have to honestly tell you that the COVID situations delayed some of our in vivo experiments, because for quite a long period of time, we cannot have concentration of people in the laboratory and in the animal facility. So we have to postpone some of this experiment. So I'm sure that we're going to finish by the 24 and probably a little more on the 25, but I cannot assure at this moment. We have, we started without COVID, and we was happy and having a lot of beautiful work together and all the laboratories that are involved in the research. But COVID, in particular, the first period of COVID, delayed us some of them. And this is why we are in a little delayed. But I still think that we are not too bad. We are not too bad. But I cannot give you now a exactly figure. Honestly, if I tell you a figure, probably I will be mistaken in one way or another. So Diana, I'm sorry, I cannot answer you, only telling you that we are running well. As you know, we have the candidate clear, we have the mutants already in the animals. We have, with the mutant, we're going to have the DIVA probably soon, but we have to finish with the mutant safety experiments that are important in order to obtain all the security and the permissions that we needed. So I cannot tell you a figure for sure. Now the second one is coming from Greece. Thank you, colleagues from Greece. There is a hybridization of wild boar in different level with the domestic pig. Should be the vaccine approach considered an issue with different treatment? Well, we think we are working, as you know, already in domestic and wild boar vaccinations. In the wild boar vaccination, it's going to be orally because cannot be another way. In domestic, we have a lot of more possibilities, and it's fantastic because there are many other possibilities, many different routes of immunization. But in wild boar, we have only orally. So we have to work with orally only in wild boar. So that means probably you think, well, this is the same. No, because the immunization mechanism is different. We have to be very secure of the doses, very secure that the animal eat and they also chewing that for a while. So at this moment, I don't think that probably the product could be the same, but the doses and the route of immunization is probably going to be different between wild boar and domestic. But we're going to produce for both, for sure. Now the next one is from Balto. Thank you, Balto. That's other species of ticks. Transmit the virus? No, Ornithodorus erraticus is as soft ticks. These are the only ones, Sodex are not. The Ornithodorus erraticus is not a mechanic, only a mechanic transmitter. Also, they amplify the virus. So in Ornithodorus, and the virus can be replicated and increase the virus titer a lot. So that is the ones that is very well adapted to the African swine fever. There are some studies even that said that probably the origin of the virus is in the ticks, but this is still not clear, so I cannot tell you for sure. Okay, where we are now? Oh, here. Anita, please, what is your, thank you, Anita. Please, what is your experience? Do you expect that different wild boar population in Europe, excluding Sardinia, will react in different way to the vaccine? Well, I don't think so. I don't think so. I think it's going to be not as, because it's like when the pigs, you know, pigs are reacting the same. And I think wild boar, so far, all the ones that we observe in different places can be infected by the virus of ASF. We don't see any kind of difference so far. So I don't expect that, but as always in science, we cannot be sure until we tested all the difference. But with the ones that the experiences that we have, more than in the vaccine, in the infections, I think that in Europe, all of them are going to be very well vaccinated. Yes, Anita, I think so. Now we have another from Wales. Somebody moved. How is it possible to administrate vaccine to swine in a stable with 1,000 and more animals? It seemed very difficult. Well, already the vaccination in domestic and for all the diseases are mostly by injection. So there are different type of injections. We can use a different system. We are evaluating different system of inoculations, but in general, in swine, all the vaccinations, most of them, because orally is a few, but most of them are by injection. And so this is why we distinguish between the vaccine and the vaccination procedure in swine. But if you look around on the world, the vaccination, more than 95% of the vaccination in swine are already by injection, and they are working very well in many diseases. So that's possible to administrate it for sure in the farms. There are special people that know how to do it with a large number of animals. Thank you for your question. Now, Katharina, you know the poof. Ah, you were moving, Raquel. Okay, thank you. You know, with a road period to the meat vaccinated pig, No. This is one of the experiments that we have. We take meat of all the animals that has been tested until now with our prototypes, and we are going to evaluate also with the mutant prototype to be sure in different part of the meat if the vaccine for how long period is still present or not. Yes, it's a good question, Catherine. We're going to be sure before finish our studies with this question that I consider important. Thank you, Catherine, for this, because I didn't clarify at the beginning. Thank you. I have another from Raquel is moving me that the use of vaccine should be prioritized to the use of population of rare and engagement wild pig species in Asia, such as the Baltic pig. Wild pig, especially group, is very worried about ASF spread in Indonesia and Philippines. Okay, the disease at this moment in Asia is spreaded already, Philippines too. I mean, the situation in ASF already is in Asia is really very, very complicated, not only for the vaccine that they are using, but also for the virus, the disease itself. So they have a very, very high spread in the wild, and the wild boar, they don't declare in Asia. Very few cases in Asia, but we know that must be the same, because we are very, very worried how it is spreading in Asia. In our vaccine, we are evaluating always spreading in domestic and wild boar, and is so far with the study that we have, but we have already to do also in mutants. The spread was very, very little. You have some animal with a very short period of time, and only in one of animals we found, only in one, we found some antibodies, never viremia, but some little antibodies, so some virus went there. But the period of spread is very short, and we found that is no animal so far. We have to test in now mutants, because as I told you, probably our final vaccine will be not the original attenuated strain that we start. We start with this attenuated strain because we saw that this attenuated strain has a very cross protection. So that's why we prefer to start with virus that give a very cross protection, that with a regular virulent virus that you don't know if produce protection to different, not only to the homologous, but different heterologous. That's why we start with the attenuated, the natural attenuated vaccine and prototype. But now, because of DIVA, we moved to the mutants. So we have to check at that in the mutants as well to be sure that the spread is going to be even less, for sure, but we have to test it. So I cannot answer in the mutant. In the other, as I told you, only one animal we found that once has been in contact that have a little antibodies. We never found the virus, but of course they have some spread because they have antibodies, but no virus, but only one of a lot of control. So that is what I can tell you. Thank you, Stefano. In the Gozar, the next question is, do you know how long immunity will last after vaccination? No, not Gozar, not at this moment. We know in the attenuated original prototype, but and that was for long period of time. But in the mutants, we don't know if it's going to be higher or not. So, and we're not going to vaccinate it with the single attenuated, as I told you, because of DIVA, it doesn't work good. So we are moving now to the mutants, and we don't know the immunization. We have the animals already, the first animal already 1 week, a little less of 1 week. So we're going to know very soon. Thank you for the question. Will you test the vaccine, how the effect is when we are eating the meat? Well, that's a good point too. This is a good point too. I really don't think that it's going to have any effect. But as I told to the previous colleague, we still don't make testing. How is the vaccine in the meat of the vaccinated animals? We still don't don't have good laboratory tests with different meat pieces to see if for how long the vaccine is going to be. So we have a sample from the original candidate, but we don't going to develop until we also have meat from the mutants one that are going to be the definitive candidate. So we're going to do that because I think it's important and it's a good point. Thank you very much, but so far I cannot answer to that, but it's in our protocol to do it. Now, Spectator Anonymous, okay. Will you test the safety for other wildlife that can be fed on the bait with vaccine for wild boar? Yes, but the studies on wildlife that we have is, as you know, is not too high studies in different species, but by the contact with the animal infected with African swine fever has been no reported so far an important implication of other wildlife. But for sure, this is a very important point to evaluate it. Thank you very much for the question. Marcel Cosina, what still be the market and the future, the Lesions or GMO vaccine? Well, our idea at this moment is to do by both, but for sure by PCR is going to be easy because it's one gene that we're going to remove. By antibodies too, because the genes that we are deleted are genes that induce specific proteins that are going to be not present in the vaccinated animal. So the DIVA that we are preparing is going to be useful with both systems, with humoral and with PCR. Thank you, Marcel, for that good question, because I don't clarify before. Thank you very much. Marcel, you have another. The field trial will be held in Kenya, according to the EMA recommendation. The field trial, we are in Kenya. We are working already with the Kenyan authorities. So we're going to follow mainly in the Kenyan authorities because they are, Kenya belongs to Kenya. And so we are already in the preliminary conversations with them. They already tell us where could be possible. ILRI, that is the center where we're going to do that, is one member of the consortium of VACDIVA. We have one person of ILRI working with these authorities. So we're going to follow in all the recommendations for sure. But EMA for sure for our final product in Europe for sure and in the world. And probably if we have at that stage our prototype ready with all the EMA requirements, we're going to use that in Kenya as well. But we have, first of all, to be sure that the requirements from Kenya authorities will be complete. This is the first priority at this moment. El Golkin, hello, Golkin, friend. In connections with the detection of ASF1 genotype virus in China, how do you think is relevant to use a different methods of research from the regions of Russians and Far East? That's a good question, Alexei. Very, very good question. This is one of the things that we are working and not only in VACDIVA, also at the OIE. They are interested to see how we can provide a good test enough to distinguish genotypes. But already we have in both laboratory and us as a OIE reference laboratory, as well as in the other Spanish one, in my former house in CISA, we have molecular system to make genotyping. So I really recommend it to do the genotyping, Alexei, because it's not the same to detect one virulent ASF in one country than an attenuated one. Because if you have an attenuated one, the early detection is going to complicate a lot more. So I think it's very important to all the European laboratories, of course, and the rest of the laboratories to have both systems. We can contact later, Alexei. I can send you information from our lab how we are focusing that study Also, we are very much in touch with FISA INEA to have the same conference and the same goals. So we're going to provide all the facilities if you want. I think it's a very important issue, Alexei, and I thanks for the question, because now there are so much amount of virus circulating in ASF, so much around that are living every day, that it's very important to have both tests, because they can make a very important decision for the surveillance system. The attenuated strain, as you know, they give very low picture, very low clinical picture. It's only, they have a longer period of incubations, and they have animals that have sometimes a skin lesion and swell inflammation in the joints, joint inflammations, and some little hole in the skin. But there are very few the lesions, and also the people are not used to detect this kind of lesion. So I think the laboratories around the world should have this genotyping for diagnosis ASF. And as I told you, we are working in all of them, the laboratory NEC for African swine fever, and already we have that possibility with the genotyping. So thank you, Alexei, and I contact you. I send you what we have so far. Thank you. Now we have another from Marcel Cousin. The oral route of vaccination will be similar to mechanisms of vaccinations against rabies. The mechanism, the eruption of mucus, or the secondary gill, the mucus of gut, stimulation of IgE antibodies. The mechanism is going to be orally, and we have a very good immune response with the oral vaccinations. I am sure we have replications in the mucus, as well as we have replication in general. So I think that it's not exactly the same system that the rabies vaccine. Our is going to be a mutant with the information, but the replication is in both places. And we know that because we evaluated other candidates that don't replicate it well in orally, and they don't have good protection. So the system have to be in both places. Thank you, Marcel, for your question. Maurice, how expertise will be the vaccine and can be purchased privately? Thank you from Latvia. No, Maurice, thank you very much for the question. As you know, the vaccination of exotic diseases or this type of diseases are regulated by internationally. So the country have to accept it to vaccinate it or not. So it's a very much regulated by international. You cannot buy directly from anywhere. So it's only, the vaccine is only given to the countries that have the permission and they decided to use it, etc., under some particular condition. So it's never going to be bought in pharmacy or drugstore or whatever, for sure. Thank you, Maurice. Thank you very much. The following is Gosar. If the vaccination protocol already known in Europe, America, Asia, how and where to start for better efficacy, when the vaccines will be available? Gosar, we don't have the vaccine yet. We don't have the vaccine yet. We have already, as I told you, prototypes. The first prototypes that we used was good candidate to have cross protection and no side effect, but no DIVA. So now we are doing the other possibility that is under mutants, using as a parental virus the attenuated virus that we have, and they give very good results. But we have now to check up that DIVA is running well and the mutant keep the safety and keep the immunization. So we are now in this point. So I cannot tell you when we're going to finish. We already are doing all that in domestic as well as in wild boar. So probably by the end of the projects, we're going to have quite a very clear picture, but probably also we will need a little more time to finish all the details. But I hope by the 24 or middle of the end of 25, probably we will have a very beautiful picture of our candidate. Now, Carlos, I'm glad to see you, Carlos, even by this, Carlos Martins. Glad to see you, Carlos. Good morning, Jose. What about the appeal of ASF Genotype 1 in China? There is very bizarre. Any idea why? I don't know, Carlos. I really don't know. Everybody is very worried in all the international, all the people that we work in ASF. We have meetings about that with OIE. They call all the laboratories. You know, we don't know. As you know perfectly, because you was coordinator of two important European projects in African swine fever. This virus has been given to several of our colleagues in the past in different laboratories, but we don't know who was the person or the labs, or we have no idea who gave it to the private Chinese people. I really don't know. This is one of the things that we are very worried, Carlos, but we try to see if we can make changes or differences in the virus that the Chinese are using in comparison with the original one, but that is going to be taking time. It's complicated, as you know, because little mutations don't mean nothing. So yes, it's a good point, Carlos. And really all of us are worried how these people get that virus that has been only in laboratories for year and year and year. Thank you very much, Carlos, for the question. Thank you, and I'm very happy to see that you are in plain form. Great, my friend, thank you. So, look like it's no more question. Thank you, Carlos. It's no more questions, so I don't know how we are in time. We are still in time? Okay, so we can have 10 minutes more. It's another question from me or for Dr. Elivisius. If you want to do it, we will glad. Otherwise, we can stop the session, have the coffee, and come back a little early. I think that could be a good idea because we have a surprise. Well, not a surprise because you know the agenda, but in the third round table, we have two special guests of the projects we thought will be very interesting to show you how was the strategy that our colleagues from Czech Republic and from Belgium did to make free of ASF both countries. So we invited both interesting and wonderful colleagues that they was involved in these studies. And so we have a special presentation for both of them. So probably will be good if we take this free time. It's only 10 minutes ahead, and we go to the coffee and we can come back 10 minutes before. So we can come back like 11:50. Is that okay, Raquel? Okay. So guys, see you in 11:50. Thank you very much for joining us and for following us. It's really a great pleasure, can tell you, for all of us, for all the VACDIVA consortium, for all the people that working with us, a pleasure to have you. Thank you very much, and I see you in a couple minutes. Thank you. Okay, we are back. Hello, everybody. We are back. So we're going to continue with the presentations. We're going to start now with the roundtable. The roundtable one, that is the ones that is dedicated. Just to give you an idea, this roundtable is dedicated mainly to the prototypes. Where are the vaccine prototypes that we have, and how are the situation? For this roundtable, I'm going to tell you who are the people are going to be with us. It's going to be coordinated of this roundtable. The coordinator of the Work Packets 2, Adam Valid, is also going to be with us in this roundtable. Carmina Gallardo, that is coordinator of Work Packet 4, Erwin van der Worp, that is from the company, that is going to be very important part of this project, and this Work Packets 1 or Roundtable 1, and also myself, that I am in charge of the wildlife vaccination. So I hope that, Adam, you have the floor now to make the first review of this area that we're going to cover in the roundtable. Hello, Adam, the floor is yours, please.
And also, thank you very much for the possibility that I can talk about DIVA vaccine generation in the frame of the VACDIVA project. But before going to detail, I would like to stress again that we don't have a registered vaccine against the disease yet, and we don't know exactly when it will be ready. But even if we have got a vaccine, this will not be a wonder weapon. So this won't be the only tool against African swine fever, but it will have to be used together with all the other control measures. And in this respect, there is a very, very significant role of the hunters in the battle against the disease, like decreasing the overgrown white boar population, and also finding white boar carcasses, sampling them for diagnostic tests, and also disposing them safely, and also the close cooperation with different authorities, among them the veterinary ones. So this is not an easy task to generate a vaccine against African swine fever because of its complexity. So if we take very simple viruses like parvoviruses or postal circovirus 2, which have got a very limited number of genes, there are excellent registered vaccines against these diseases. If we take PRRS virus, which is a middle complexity virus with 10 genes, and with a lot of risks against the immune system, there are not ideal but quite well working vaccines. But as Jose Manuel mentioned, African swine fever is a complex virus. It has got more than 170 genes. It has got a very long DNA genome, which is at some places very variable. The virion is very large one, and it has a very complex structure. And also the virus has got more than 40 immunogenic proteins. So therefore, it is not easy to generate a vaccine against it. And this virus has got several tricks to deceive the immune system. But in spite of these difficulties, there are intensive efforts to generate ASF vaccine types. So the easiest to generate is an inactivated vaccine, which is safe, but it can confer only very, very limited partial protection, and it hasn't got DIVA capacity. So DIVA means differentiation of infected animals from vaccinated animals. There are also subunit vaccines, DNA, RNA, recombinant protein, and virus vector vaccines, which are very, very safe, but they also confer only partial protection, but they have got DIVA capacity. So the challenge to generate this kind of vaccines is the selection of the appropriate genes or antigens, and also their constellation. The live attenuated vaccines, which can mean naturally attenuated strains or tissue culture pastiche strains, have got variable safety, but they confer long-term cellular and humoral immune response. They are highly efficacious, and they also provide cross protections, but they don't have DIVA capacity. So in the frame of VACDIVA project, we aimed to generate recombinant gene-deleted live attenuated vaccines, which also confer high efficacy and cross-protection, but they have also a DIVA capacity. But also here the challenge was to find the appropriate genes to be deleted. And for this reason, we used the international technical literature and also previous data from the VACDIVA project. The biggest problem with attenuated vaccines is safety, because this kind of vaccines can revert to a virulence one. So it means that the vaccine is administered to the animal and the virus is replicating in the host, and it can regain its virulence and it can spread to contact animals and the acute form of the disease develops. The other drawback can be the development of the chronic form of ASF after vaccination or after vaccination and infection. So this form is characterized by skin lesions like skin necrosis and then swollen lymph nodes and joint swelling. So we have, as Jose Manuel mentioned, three vaccine prototypes. So the first one is LV17Y-BOLRIA1, which is a genotype 2 naturally attenuated strain from Latvia from 2017. And in previous experiments in white boar, it conferred 92% protection against the challenge with a highly virulent Armenian 2007 genotype 2 virus. And it also conferred 100% protection against different genotype 2 virus strains. The second one is the NHP68 genotype 1 naturally attenuated Portuguese strain from 1968, which conferred 100% protection in domestic pigs against genotype 2 and genotype 1 highly virulent viruses. The third prototype is ASF Ariak CV1 strain, which is a genotype 2 laboratory attenuated strain from Russia, and it also conferred 100% protection against the Armenian 2007 genotype 2 strain. So altogether, all the three prototypes are naturally or artificially attenuated strains, which have got proven cross protection. So our strategy is use this kind of strains, and this is in contrast to other research groups who started their vaccine development from highly virulent viruses. So in the first year of the project, these vaccine prototypes were fine-tuned, their efficacy and safety were increased in animal experiments. But in the second year, these vaccine candidates were further improved. So we generated deletion mutant vaccine candidates to improve safety, efficacy, and to gain DIVA characteristics. Therefore, we deleted genes which plays a role in virus replication and also genes of immunomodulatory function proteins. And for DIVA, we partially or completely deleted the genes of antigenic proteins, which do not affect safety or efficacy. So to reach this goal, we applied homologous recombination or serial cell passages, but mainly the CRISPR-Cas9 technology, by which we could delete, insert, or replace genes in the genome of the African swine fever virus. So in our constructs, the deleted genes were replaced by fluorescent reporter proteins. So in the picture, you can see the fluorescent vaccine candidates. As for the Latvian vaccine prototype, we deleted 5 genes in different combinations. So we have several single and multiple mutants, deletion mutants. And in the case of the Portuguese prototypes, by the end of this March, we will have 2 deletion vaccine candidates, and in Russia, they are also working on different vaccine candidates. And also the respective cell lines were also discovered, and the viruses were adapted or being adapted to these cell lines for large-scale vaccine production. So as a result of our efforts, we would like to improve safety to 100%. So this is our main goal, because now our vaccine candidates have got quite good efficacy. And as Jose Manuel mentioned, the DIVA characteristics also will be a very important issue, because the vaccine cannot be marketed in Europe without DIVA characteristics. So we are working now on this one. Sorry. So as for white boar vaccination, this can be done only orally with the use of baits, and an ideal bait should be quite resistant to different environmental conditions, and it also should be attractive not only for adult white boars but also for the young ones. So these parameters were assessed in different white boar experiments. First, the experiments were carried out in animal facilities, and it turned out that the baits showed quite very good resistance even at higher temperature. And also they were taken up by not only the adult animals but also the young ones. Then this kind of experiments were continued in white boar farms and also in hunting grounds. And it turned out that among the different bait prototypes, one proved to be superior to the others. So it contained paraffin, sucrose, and cinnamon truffle powder attractant. So all these experiments were carried out in Spain, mimicking the Mediterranean climate. And these experiments will be repeated in Hungary, mimicking the continent, the colder climate. Then the vaccine prototypes and the mutants were assessed in animal experiments. So before the start of the VACDIVA vaccine project, the RIA, the Latvian virus, prototype virus, was assessed in an experiment, and it provided 92% protection. But in this experiment, the vaccine was used orally, and its titer was 10,000 infection units. This experiment was repeated in the frame of the VACDIVA project with a lower titer, so 10 to 3 means not 10 but 1,000 infections unit, and this vaccine conferred 100% protection and non-side effect after challenge with the virulent Armenian 2007 virus. So better result was obtained with the lower titer. So in next experiments, even lower titer will be assessed. But in the meantime, the mutants arrived at UCM, and they are also assessed for their efficacy and safety in white boar oral immunization experiments, and also their DIVA capacity is assessed with DIVA tests, which are developed in the frame of the project. With the Portuguese vaccine candidate, white boars were immunized orally, but unfortunately, this Portuguese virus candidate didn't confer any protection. So this virus will not be good for as a white boar vaccine, but you will see later that the Portuguese virus candidate prototype will be excellent in domestic pigs. So the white boar experiments are now ongoing. So I will, from my side, I finished my presentation, and I will give the floor to Carmina Gallardo, who will talk about the domestic pig experiments.
Hello. Hi, hello, okay. Good morning to everybody. I am going to explain a little bit about the main findings that we had found in the domestic pig using the different lab prototypes up to now. So The main objective is, of course, to perform an initial evaluation of vaccine safety and efficacy throughout comparative in vivo studies of infectivity, immunogenicity, and cross-protective efficacy of the market vaccines, to select of vaccine formulation and posology, that means the best dose and route of administration, to do an in vivo safety studies in domestic pigs, and to determine the overdose, the dissemination, shedding, direct and indirect transmission, and to evaluate in vivo the genetic stability of the market vaccines. So, as Alan has already told you and Jose Manuel, we have performed the different trials in domestic pigs with the 3 lab prototypes. We have the advantage that our prototypes are based on attenuated African swine fever virus. So that means that we don't have the possibility to our reversion to virulence. And already we know that with the Latvian prototype and with the Portuguese prototype, the animals are protected, fully protected, 100% of protection in wild boar and domestic pig using the Latvian prototype. And with the Portuguese prototype, we know that in terms of protection, of efficacy of the prototypes, we have a full protection against heterologous strain as is the Armenia strain. So, as Alan already explained, based on these attenuated strains, we tried to reduce the side effects using the parental viruses, the Latvian prototypes, and the Portuguese prototypes, in order to reduce the side effects using different dose and route of infections. We performed an experimental studies using a low dose and a moderate dose and 3 different routes in domestic pigs. And we infect with the parental Latvian strain. Sorry. After vaccination, the safety studies, we established the safety parameters that were measured in terms of the development of secondary effects related to chronic infection and mortality after vaccination, but in the presence of humoral immunoresponse. This was used to measure that the immunization has been effective. After the vaccination with the parental Latvian strains, we observed, depending on the dose and the route of immunization, adverse clinical reactions that were mainly associated to cyanosis, lymphadenitis, respiratory distress, and swelling of joints. This was already observed in the preliminary infections with the Portuguese and Latvian strains that we did in the domestic pigs, but not in wild boar. This was strongly dependent of the dose and route on immunization. The protection studies, we measured the protection parameters in terms of survival, development of clinical signs related to acute disease, and shedding of virulent strains. This is very important because we want to have a safe vaccine and not shedding the virulent virus. We performed the challenge using the Armenia virus, the related genotype strain, between 28 up to 30 days post-vaccination. According with our previous finding in the preliminary result, all animals, independent of the dose and the route that we use, all animals that seroconverted were fully protected against related genotype 2 virulent African swine fever virus. As you can see in this slide, the non-vaccinated pigs that were infected with the Armenia virulent virus died within 8 up to 10 days with severe acute form. But in our case, all animals immunized with the parental Latvian prototype were fully protected after the challenge without any clinical signs. But, and this was very important, also vaccinated animals were fully protected against virulent challenge with no clinical symptoms. We observed that around the 40 up to 50% of the animals eliminated the virulent strain from the 3rd week post-challenge, even in the absence of clinical signs. And around about 57% of the animals has the virulent strains in some tissues 1 month later after the challenge, and even again in the absence of clinical sign. These findings were very important because the most important for us is the safety of the vaccine. So even if the animals are protected and no clinical signs are observed, using the parental strains, we had the shedding of the virulent strains. So as conclusion of the parental virus, the Latvian parental strain is effective, but not safe. It's effective, but because all the animals are protected, fully protected, but depending on the route and dose of administration and the immune status of the animal, this prototype can produce side effects and or shedding of the virulent strains. So, making a balance among safety and efficacy, of course, safety is the most important for us. Similarly, we observe similar results using the parental Portuguese strains. After challenge against, all the animals were fully protected, 100% of protection, and here we observe an cross protection even using a genotype different than the parental strain. But again, similar result after vaccination. Safety concerns related with the production of side effects. Around 70% of the pigs after immunization with the parental Portuguese strain could develop adverse clinical reaction mainly associated to lymphadenitis, swelling of joints, and necrotic foci, as you can see here in these pictures. So it was very clear that also starting from an attenuated prototypes, one from genotype 1 and the other from genotype 2, it is strongly needed for us and was a priority to generate a marker vaccine. To generate a marker vaccine because the production of the side effects, but also because we need a DIVA. So in this context, in the last months, we have already tested in domestic pigs 3 marker vaccines generated from the Latvian parental virus. We have tested 3 different mutants, and the results had been compared with the parental group. We have used the intramuscular route and the overdose, because for us it's important to use these extreme conditions in order to check if the mutants that we are using, the marker vaccine that we are using, are totally safe in domestic pigs. So, from the results, preliminary results that we have obtained after vaccination, we have improved strongly the safety with the mutant 3. The animals generated a strong immune response, all the animals survived, and the clinical signs were extremely low. And the most important that after the challenge using the Armenia virus, these mutants don't lose the capacity to protect the animals. We obtained a full protection in animals that were immunized with the mutant 2 and the 3, that was safety in absence of clinical signs. So these preliminary results in domestic pigs are very promising, although more studies should be done. With the mutant 3, we have improved the safety and we have maintained of efficacy with 100% of protection. But of course, we have to perform more additional studies, and these studies are ongoing related to the shed of the virulent strain, the cross-protection level, the steroid immunity reference to complete protection, the transmission studies to sentinel animals, domestic pigs, and also wild boar, and to safety in the most weak animals like pregnant sows, immunosuppressed, etc. Well, This is the same slide that already Jose Manuel presented from the beginning, that this is the main points in which the vaccine research has been done or ongoing. So I am not going to repeat this, but the most important point after the trials that we have done in the domestic pigs is that now we have promising results with marker vaccines in terms of safety and also in terms of protections. Of course, we have to test more marker vaccines and to test in parallel in the wild boar, as is doing currently at the UCM. So thank you very much.
Oh, okay, thank you. Thank you very much, Carmina. The next speaker is Erwin. Erwin is, yes, Erwin is coming from MS. As I mentioned at the beginning, MSD is the company that is working with us, and we are really doing a very good job together, the team of VACDIVA and the team of MSD. So the floor is yours. Thank you very much.
Thank you, Jose Manuel. My name is Erwin van der Born, and I'm working in the research department of MSD Animal Health. My responsibility is to coordinate all the work that we need to do to produce the vaccine that our smart people in the VACDIVA project are developing. And so a lot of coordination work is needed from our side. And one of the things that we're doing is to prepare the company for producing the vaccine. A lot of things need to be done, but I just want to highlight a few things that might be of interest for you. One aspect I want to stress once more is that we are working on two vaccine types, one for wild boar, which probably will be given via the oral route with bait in the field. And the other one is for vaccination of domestic pigs via the needle, most likely. And you can imagine that this requires two completely different types of vaccines. It could be the same vaccine after all, but the way we produce it is completely different. This also, of course, internally in the company requires some modification, because we probably need to have two different production lines for the two different types of vaccine. You may be aware of the fact that the African swine fever virus doesn't grow that well on commercial cell lines. And with commercial cell lines, I mean cell lines that are normally used in the pharmaceutical industry. So cell lines that are safe and fully tested. This is a big problem, and quite a lot of research has been done, and some even have proposed to produce the vaccines on, for instance, cells derived from live pigs, or even use the pigs themselves for the production of vaccines. And this is, of course, a big risk, using live animals as the source for vaccine production, because these animals may contain diseases, viruses, bacteria, and you don't want to have those pathogens in your vaccine that is most likely going to be used in mass vaccination programs. So for us and the VACDIVA consortium as a whole, using pig cells or pigs as a production source is a no-go. That, of course, has some implications, because if there are no cell lines, then we cannot produce. But luckily, our efforts in VACDIVA have identified a couple of commonly used cell lines, and we are now working on them to make them the cell lines for the future production. So we can assure you that we will use the cell lines that are safe, fully tested, will not contain any viruses or bacteria, and we will use them in our production once we have the vaccine candidate. So if everything is ready, we have the cell lines, we have the vaccine candidate, we are ready to produce. There are, of course, a few questions. One of the questions is, in what type of facility can we produce? For instance, if we would produce in the Netherlands, where currently there's no African swine fever, I assume the government wants us to keep the vaccine strain as much inside of the facility as possible, because even a very safe vaccine strain is an unwanted guest in a country where there's no African swine fever circulating. So that could mean that we have to produce in high containment facilities, like for foot and mouth disease. But it could also mean that we get approval to produce in low containment facilities. That all needs to be discussed with governments. Another thing that is, of course, important is that African swine fever is considered a dual use agent, so it could theoretically be used as a biological weapon, and there are all kinds of regulations around it. So we can produce it, but then the question is, are we allowed to transport it to the customers? And that's also, of course, part of the ongoing discussions we have. Once everything is ready and we are applying for marketing authorization, of course, we will make sure that the vaccine is safe. And as many of the team has already mentioned, the highest priority is safety. But of course, a vaccine should also be efficacious. It should cross-protect against different virus variants. Very important for the person vaccinating is that the vaccine is stable, so that it is still in full force the moment the end user is using it. So there's no decline in quality. And very important, of course, is that there are no extraneous agents present in the vaccine, as I mentioned before. So no unwanted viruses, no unwanted other bacteria. So only the vaccine strain should be in the vial. We will, of course, comply to the EU requirements, but if we want to go for other markets outside the EU, then other requirements, of course, apply. And we will, of course, make sure that we comply to those as well. Regarding the market, there was already a question in the chat about the sale of the vaccine. Will it be available for everyone? I think initially the vaccine will be provided by governments, regional or country governments, in a type of tender way, where the government provides the vaccines for national, international vaccination programs. But later on, further down in the fight against the disease, there might be also commercial sales, like for standard vaccines. But all that has also to be discussed with the authorities. And with that, I want to stop here, and happy to take questions if there are any.
Thank you very much, Erwin. Thank you very much for the presentations. Now this roundtable is open for discussions or questions. So please, if you have any questions, you can just make it. It's going to be listeners, Adams, Carmina, Erwin, and myself. So if you have questions, go ahead. If there's no question, we move to the next roundtable. We're going to wait a little to see if there are any questions coming or not. Okay. So that's good. That means that everything was very clear. Thank you very much, guys. Thank you very much. So we're going to move to the next roundtable. The next roundtable is going to be coordinated by Paloma Rueda. Paloma Rueda is from Ingenasa, is the company that is, with a large experience in African swine fever diagnosis. And this is part of our consortiums, and this is in charge of our DIVA test. So Paloma, please, the floor is yours. Thank you very much.
Okay, good morning, everybody. Thank you, José Manuel, for your presentation, and thank you also all the people who are attending this international meeting. So, well, in this roundtable, I would like to present you the main objective that we have in the VACDIVA project regarding the diagnosis of African swine fever and what we are doing now. But first, I would like to give you a very brief introduction about the current situation of the diagnosis at laboratory level. Well, we all know that African swine fever is a very complex virus with more than 50 structural proteins. Some of them are used as target antigens in the available diagnostic tests that we use nowadays, for example, the BP72, 62, or P30. These proteins are very immunogenic and induce antibodies that persist during long periods of time, but however, they don't induce neutralizing antibodies to stop the entrance of the virus in the cells. So there is not a vaccine available yet, so the presence of antibodies in a sample indicates an infection. Currently, the biosecurity and the early detection of the presence of the virus are, as we all know, key points for the control of the disease, and therefore it's clear that the laboratory diagnosis is essential and the techniques should be sensitive, specific, and rapid to have an accurate diagnostic as soon as possible. Nowadays, at laboratory level, we are using two kinds of techniques. On the one hand, we use direct techniques for virus identification, for example, by hemadsorption. This is a gold standard technique, although at the same time is a very laborious one. Other alternative is to identify viral proteins by different techniques like ELISA or immunochromatography. And the last option is the detection of the viral gene by PCR, and in this case, is also possible the identification of the virus genotype, that this is really very important. On the other hand, an indirect way to detect African swine fever infection is the detection of specific antibodies against the viral proteins by different methods, such as ELISA or immunochromatography. The highlighted techniques are the most used for screening purposes and surveillance programs, while others, for example, Western blot, immunofluorescence, and others, are used in some cases as confirmatory techniques. It is important to keep in mind that the information that we obtain by the direct techniques and the identification of for the identification of the virus, and also the serological techniques, is techniques that are complementary, and in many situations is very important to have both information. It's important to use both kind of techniques. In the frame of the VACDIVA project, we are working on the development of a companion DIVA assay that, in combination with the marker vaccine, permit the differentiation of infected from vaccinated animals. As you know, this is the concept of the DIVA assay, and the use of the marker vaccine together with the DIVA assay will be crucial for a later control of African swine fever. A similar approach is used nowadays for the control of some other diseases. For example, the Augeski disease, that I'm sure that you all know very well. In the next figure, I would like to illustrate the strategy followed to generate the marker vaccine and then to develop the DIVA diagnostic assay. On the left, a diagram of the genome of the parental virus is represented with two genes coding for the protein ARB. And when the virus infects the animals, of course, its immune system reacts to the viral protein and will produce antibodies against this protein. In the case of the gene A, this is an example of the protein that we are nowadays using in the diagnostics test. For example, the P72, P30, or others. Okay. And on the right, you can see the diagram of the marker vaccine genome. On one hand, we have been deleted the gene B, and we have substitute, you have introduced a marker gene in the vaccine. So the vaccinated animals will produce specific antibodies against this marker protein. So based on this strategy, we are working on the development of DIVA assay based on PCR, because we will be able to identify the different genes. But also we are working on the development of a serological DIVA assay based on the detection of specific antibodies against this protein. In the next slide, I just wanted to show you in a very simple way the interpretation of the possible result that we could obtain with the DIVA assays. If the result is positive for the gene A and B and negative for the marker, we are with a sample of infected animals. If the gene A and the marker is positive and the B is negative, we will have a sample from vaccinated animals. This approach can be used not only for the PCR, but also for the detection of antibodies against this marker. Now also a few words about the roadmap that we are following in our development and the current situation of the DIVA assay within the VACDIVA project. After the identification of the target genes for producing the marker vaccine, in the case of the DIVA PCR, we have working on the selection of the best performing condition for the detection of the individual genes. Then we have also worked on the optimization of a triplet PCR for detecting the 3 genes that I mentioned before. Some of these stages are already done or partially done, okay? And in the case of the serological DIVA, based on the antibody detection, the first step is the production of the target antigen. So we have to produce the protein by the expression of recombinant protein in different systems. We have choose the best one depending on the characteristics of the target antigen. And then we have to study to analyze the evaluation or to do the evaluation of the immunogenicity of this target. And then after the development of the assays, of course, we will do the standardization and validation of these tests. In the case of the DIVA for antibody detection, we are working on different platforms and formats. On the one hand, we are working on 2 different platforms that will be used at laboratory level. One of them is the ELISA that you all know very well. Another is the ARISE. These techniques, this technology permit identify different targets simultaneously in a single well of a microtiter plate. And for example, we could detect at the same time antibodies against the 3 targets that I had mentioned before. And moreover, we are also working on other formats to be used in the field, but also in small labs. This is the case of the lateral flow assay that I guess that after the COVID situation, you are very familiar with this kind of technology. This kind of test is very easy to use. We have to put the sample in the window, then we have to add the buffer, and after 10 or 15 minutes, we will know the result, and we can see if the sample is positive in the case that we have 2 bands, or if the sample is negative, if only have the control line. To do this test, there is not necessary any special infrastructure or a special personnel to do it. So We have the result in a very few times, so we can take quick decision and support local diagnosis, and this is very important. Now, I'm going to present you some preliminary results of the evaluation of the selected target as potential antigen in a DIVA assay. So far, we have analyzed a limited number of samples from experimentally infected and vaccinated domestic pigs. And as you can see, the sample from the infected animals here in this panel are positive. They have antibodies against the gene A and also against the gene B, that is our marker in the vaccine. And they don't have antibodies against the reported gene. In the case of the vaccinated vaccine, the samples had antibodies against the gene A and also against the reported gene, the market, but they don't have antibodies against the deleted genes. In order to study the specificity of this assay, we have analyzed a panel of 21 experimental samples, negative samples, and 79 field samples, and all of them were negative with the 3 genes that we were analyzing. So this preliminary result indicate that these targets are promising antigen for the development of a companion serological DIVA assay. Finally, I would like to present you the preliminary result. Sorry, I don't know what happened. Sorry. I would like to present you the preliminary result obtained at EU reference lab in CISA in Madrid, when samples from experimentally infected and vaccinated animals were tested by the triplex real-time PCR that they have developed. So it's possible to identify the 3 genes in the same PCR. As you can see here, the result for the gene A is positive for all the samples studied, the vaccinated and the infected sample from infected animals, all of them were positive, and this is the negative control. In the case of the V gene, only the samples from infected animals were positive. Only positive the vaccinated, the sample from the vaccinated animals. So this result indicates that it will possible to carry out a DIVA assay based on PCR, the similar that we have obtained with the serological test. Once we finish the development of this DIVA assay, the last objective within the VACDIVA project is the adaptation of these assays to be used with non-invasive and alternative samples, such as oral fluids or oropharyngeal samples, for example. And finally, we will do the standardization and validation of the assay through a proficiency test among the different laboratories of the consortium. As a final conclusion, we can say again that the laboratory diagnosis is essential for the control of ISF, and within the VACDIVA project, we are working on the development of validation of new companion DIVA tests based on PCR and based on antibody detection. The use of the marker vaccine with companion diagnostic tests allows the distinction between infected and vaccinated animals, and the preliminary results that we have so far are really very promising. So this is all for my side. Thank you very much for your attention, and if you have any question, I will try to answer you. Thank you very much.
Thank you very much, Paloma. We're going to open this roundtable for discussions or questions. No question, Paloma.
Okay.
Question from our guest. So we're going to move to the last table, the last round table. Thank you, Paloma. Thank you again.
Thank you very much.
So we're going to move to the roundtable number 3 with the presentations that, as I told you, this roundtable is summarize what we are doing in the epidemiological point of view, how we want to see the epidemiological status, how we can use our vaccine to control the disease, and also we're going to give you some of the points that we are already working, as well as we have 2 special guests that I am sure you're going to enjoy very much. So let me summarize, because already in my introduction talk, I already mentioned some of the things that you're going to see now. These are the objectives of this roundtable. The objective of this roundtable, as you can see, is especially we are working in the different epidemiological scenarios, not only in Europe. Of course, Europe for us is very important because this project is a European project, but we also think that we have to be carefully with the rest of the world, because if we don't finish with the disease, sooner or later it's going to come back. Already it's the 3rd time that they come back. So epidemiological and risk assessment model are how we are working on that, and the potential ASF oral vaccination and wild boar. These are one of the main points that we are evaluating in this roundtable 3, the efficacy and safety oral vaccination against ASF wild boar in Europe and Africa. This is a potential important for us. And finally, the field efficacy and safety of vaccination in the domestic and wild boar. So this is what we are doing from the epidemiological point of view. So what are the points that we are evaluating to have much better information? Some of these parameters is the one that we use for modeling. The historical outbreak of ASF in the European Union, the location of the farms, and the location of the habitat in the wild boar, because this is the only way to evaluate interactions. I'm going to give you an example in a few seconds. The type of production in backyard versus farms. In the European Union, we have a few countries, little countries, 2 countries already, that they still have quite a lot backyard. In the east of Europe is a lot. The backyard that there is in Asia is already unbelievable. And in Central America and Dominican Republic, NIT also is a lot. So this is a very important point that we have to evaluate it very well, because as I mentioned to you, the mechanism of the infected meat is the one that are making more transmission. So we have to understand what are the risky areas in the 5 continents to understand how we can help in vaccinating buffer areas. So this is why it's so important for us, this point, as well as the trade movements. For example, from Asia, if you look at this moment, there has been increased a lot the boats that come into to South America, in general to all around the world, but South America and even North America has increased a lot in the last 3-4 years. So this is a very important question. We also make questionnaire to the farmers, to the hunters. I'm sure you probably working in our questionnaire sooner or later, because we send it to many people. We want to know many parameters that they are telling to us to understand more or less what's going on in different areas. And finally, as I told you also, we would like it to do a pilot vaccinations. The one in Europe, probably we are already just in the beginning of the first discussion. The one in Kenya is already much growing up, is going faster. And the Kenya one is just to control this wildlife that is creating the cycle of the virus. I hope that our vaccine can stop that, because that's going to be fantastic for the whole world, and in particular for our people in Africa. So this is our work packets there, I mean the roundtables there. And I want to give you an example, for example, how we evaluated where are the disease more present, you know, what number of outbreak you see more frequently in wild boar. So in this case, for example, we found that in the natural areas where the wild boar are living, so at this moment in the studies that we did in some European European Union countries, we found that the 68% of the outbreaks are in natural areas. So that means where the wild boar is living. But we still have a 30.6% in the agroforestry areas. So that means that the wild boar are moving, and they are moving not only from the natural areas, also from the agroforestry, and even from the urban. In the urban areas, we have 1.3. So all these details in the different scenarios are very important to us to know how we can concentrate it. If we can concentrate it totally in these areas, or we need to concentrate it in several, and this is part of the work that we are doing. We are doing to really establish not only the potential vaccine that you see already, how our candidates are, but also the strategy, epidemiological strategy that can be possible. So the pilots, I told you already, we are evaluating the ones that is running in the conversations a little far away is Kenya. They are working to see the place. We know already the place. We know that it's going to be in the ILRI. It's going to be in a containment, but with animal of this species to see and against some of the circulating virus of ASF. So that's going to be a fantastic study too. As I mentioned before, it's going to be here. And we hope to stop these situations that is already one of the biggest problems that we have in the world. And this picture we show you several times, but this is exactly how is at this moment the situation of VACDIVA in the different important issues here. So as I also told you, we have a special guest today. We want to have, we thought that will be fantastic if you can hear directly from people that has been, from colleagues of us that has been involved in the control and eradication of ASF in the Czech Republic, as well as in Belgium. So today we are very, very lucky, and I would like to appreciate it very much to Milus and Alain, Milus from Czech Republic and Alain from Brussels, because both of them accepted our invitations and they are going to make a presentation for all of you. I really thanks a lot to both of them. Milos, thank you very much. You're going to start because the Czech Republic was the first country in the European Union to eradicate ASF, and we really, I'm sure everybody is loving to understand and to listen to you. So Milos, the floor is yours. We're going to put your presentation ready. Hello, Milos.
Hello to everybody. Yeah, so first of all, thank you for the opportunity to talk shortly about the situation which happened a few years ago in Czech Republic. I will be quite short with my talk and will look forward for the questions. So I'm working as a scientist at the Czech University of Life Sciences, the Department of Game Management, and basically I'm focused in the spatial behavior of wild boar. So if we will go what's happened in Czech Republic, so how to go through the presentation. Yes, so we found the first cases in the mid of summer in 2017, and we were a little bit surprised because the neighbor countries which were affected by the ASF were quite far from the Czech Republic, and I have to say that we had not been prepared for this situation, and everything had to be done very fast, and so we had to do the decisions on the way, and it was quite complicated. So at this moment, I think the countries will be much more well prepared, and the fight against the African swine fever will be much more better than here in Czech. So finally, we found in the field only 212 positive cases, and 18 positive wild boar were shot, and the last one we found after 10 months after the first cases. So the eradication were quite quick, and it didn't take so much time. So luckily we didn't have any outbreak in the domestic pigs. Now I will talk shortly about the measures which were taken in Czech Republic. So at the beginning, when we found the first case, the infected area was founded and was defined as an area approximately covered 100 square kilometers. And at this area, the first measure which was taken was the ban of the hunting and ban of the feeding of wild animals. So after a few weeks, when we realized the passive surveillance and we searched the carcasses in the area where we found the first cases, we were able to define the high-risk zone, which were quite small, and we try to do the measures inside this high-risk zone where the disease were really present. So we focused on a very small area, but we focused on this area quite intensively. Because the positive cases which we found were quite sharply bounded and the area were nicely defined, we decided to use some fences which were used later in Belgium or now in Germany. So we decided to use the electric fence with some odor smells and odor repellents again, or to minimize the movements of boars, the movements outside of this area. So because we were aware that the animals will start to migrate at the end of the summer from the area where they found quite a lot of food on the agriculture field, our state administrative decided to stop harvesting of some crop fields, so which means that we let there some approximately 100 hectares of crops, wheat and rape inside the high-risk zone to minimize the migration from the high-risk zone outside of this area. So the big discussion were also about the hunting. So because during the first 1.5 months, we did quite a lot of intensive inspection of the surrounding, and we were able to say that the virus is only present in the high-risk zone, and in the surrounding there are no positive cases, and we were quite sure that there are no positive boars, but the situation were quite strange. So because around the high-risk zone there were a lot of boar which could migrate in the high-risk zone or could be in contact with the positive boar. So because of that, we decided to start to hunt in the low-risk zone around the high-risk zone. So for that, were approximately 2,000 hunters trained for the hunt, and only these hunters were allowed to hunt here. All hunted boar had to be burned, and the hunters get some financial compensation for that. So we also decided to ban the public entrance into this area, which were many times discussed also by the administrative units, and the public were quite afraid that they cannot entrance the forest, the fields, and cannot use the the area, but so finally they do that. And after 3 months from the first cases, we decided to depopulate the boar also in the high zone. For that, we use some type of extensive hunting to minimize the spatial activity of hunted boar. So only 3 hunters per 1 hunting ground were allowed to hunt, and the hunting were limited only for 3 days per week, because the hunters were people who had to go to the job, to the work, as their family. So we decided that also the police will help them to reduce the numbers of boar inside the high-risk zone. And we invited the police snipers to reduce the boar inside. And it was a very nice decision, because the hunters from the police or the police snipers could be inside the area for more than 2 months and hunt a lot of boar, which helped the situation so quite faster. It helped to us to depopulate the area from the boar. So at the end of the December, so there were only a few boars remain in the area, and we could say that we were good into the population. So as my main message for you, for the hunters, and for the administrative units who will realize the measures in the areas where the ASF will present in the future, is that you should focus your activity into the area where the ASF is really present. So at the beginning, in the Czech Republic, there were the big discussion how to define the zonation of the infection, and how to define the measures and where the measures will be applied. So finally, we really focus only a small area which covered approximately 160 square kilometers. It was the size of the high-risk zone, and then we invest a lot of energy to depopulate or to reduce the numbers of boars around these areas. So in total, for example, in the infected area, more than 400 boar were found, and 200 from them were positive. Approximately 4,000 boar were hunted here in the high-risk zone, and from my point of view, were very important to decrease the numbers also around the high-risk zone. So, and we hunted during the 6 months here more than 11,000 boar, and we minimalized the numbers of boar which could be in contact with the positive one. So my message for the hunters and for the people who will define the measures is really to focus with the active measures only to the area where the ASF is present, and in the surrounding area to try to reduce the numbers of boar as much as possible. Also, the second thing which were important were the cooperation between each part of the people. So, of course, very important were the Commission, which defined the measures which was applied in the highest zone, but the most important part of people who really realized the measures were the local people and the local administrative. So it means that if we look at this table, so the plan what was done were realized on some national level with some local discussion of the veterinary services, state administrative, also with the scientific community, and of course with hunters. So, but if you look who really applied these measures, it was mainly the hunters. So because hunters search of carcasses, they trap the boar inside the high-risk zone. They install the odor fences, and with the help of the local state administrative units, they install also the electric fences. They realize the intensive hunting around the high-risk zone, and did also the extensive hunting. Based on our experience, so I really could say that the collaboration between each of these type of people and these type or groups of different professions is the key how to eradicate the disease. And I think that, for example, only the hunters couldn't be excluded from the process of eradication, and it's necessary to talk together the veterinary services, the state administrative, and the hunters associations and local hunters club. So because you have to explain to local people what is necessary, why do you apply these measures, and for how long, and so on. And this, I think, it was crucial. Of course, maybe I had to mention that this outbreak was the focal one. Now we are facing to the wave from the Poland and from the Germany, so the situation will be much more complicated. But so I hope that together we are able to reduce the effect of the ASF on the hunters and of course on the other parts of the life. So thank you for your attention, and so if you have any questions, so I'm in.
Thank you very much, Milos. Thank you very much for your presentations. We really appreciate that very much. And our congratulations to you and all the team that has been involved in this fantastic job. I would like to ask you to keep with us, because after Alan's presentation, we're going to open the discussion. So please stay with us, Milos.
Yeah, I stay here. So thank you.
Thank you. Thank you very much. So we're going to move to the next presentation. Alan, are you with us?
Hello, Jose, I'm here.
Hello, glad to see you. Thank you very much for accepting our invitations. And the floor is yours, Alan, please.
Yes, thank you for inviting me. I will try to share very briefly the Belgian experience in the eradication of ASF in our country. So, of course, this is a huge work with many people involved. I will not try to acknowledge all of them because it will be a bit longer. So may I switch to the next slide?
Yeah. Can you change it yourself, or do you want we do for you?
Okay, I got it. Oh.
That's it. Okay, very good.
So let's start. So this is the ASF management zone in Belgium. We are really in the southeast of Belgium, near to the borders of France and Luxembourg, for the ones who know a little. I put a big point in the middle of the map to show you the first ASF positive detected case. All the red dots, of course, are the positive ones, and the blue ones are the negative ones. So the size of the area is a bit more than 1,000 square kilometers. So we are something like 10 times larger than Czech Republic, and simply because the detection was not so early. It was the Warburg carcass detected in the middle of a large forested area, and it was probably it was detected in September 2018, and the virus was probably introduced for unknown reason for some weeks, probably at the end of spring or beginning of summer. So you have here the number of tested Warburg for ASF, but you have to notice that from this area larger than 1,000 square kilometers, we remove something like 7,000 Warburg because all of them were not tested at the edge of the ASF management zone. So during 2 years, we removed 7,000 Warburg from this area. So you can see in the middle, of course, the infected zone, and quite quickly there was a zoning, and I will simply talk about a wide zone all around the infected zone, because we have, of course, adapted measures according to the epidemiological status of each zone. So the infected zone will encompass every ASF positive cases. So this is the timeline according to the tested Warburg inside the infected zone only, so around 2,000 Warburg. And you can see from September 2018 till March 2021, the number of tested Warburg, and in red, of course, the positive to ASF. We had a huge peak during February 2019, so something like 5-6 months after the first detected case. But it was very fast, and let's say the last fresh ASF positive case was detected in August 2019, so around 1 year after the first detection, and we still detected some positive qPCR positive Warburg, but very old ones under the form of bones. Very later. The last one was in March 2020. So these bones, we try to cultivate the virus in the reference laboratory in Madrid, but the virus was dead. It was impossible to make it alive again. So we think that the last virus circulation in the Warburg population was in autumn, in September 2019. So that is the chronology of the epidemic. So you can see that from the next spring 2019, it looked like the virus was completely disappeared, and we were expecting to have a new wave in the next summer, but it did not happen. Of course, there are many measures that were implemented, and we take a lot of benefit from the Czech experience. The first one was, of course, to search for carcasses and to dispose them to the rendering plants. On this graph, you can see the number of carcasses that were detected thanks to passive surveillance. So it was in reality an active searching effort that was provided mainly by the authorities. 90% of the time spent for searching was due to the forest services. And you can see that we had this nice shape with a peak of carcass discoveries in February and March 2019. And then you can see that we still found some carcasses, but they were all negative ones. So probably former positive ones that turned into negative ones. And the green shape on the same graph corresponds to the time spent in hours to search for the carcass, because we had a good monitoring of this searching. And at the end, we spent something like 60,000 hours searching in this, let's say, 1,000 square kilometer area. But we mainly focus on the in the forest, because something like 90% of the dead warble were detected in the forest. So we focused on the forest, and consider the infected forest. We estimate that we covered it 7 times during 2 years. Another point is, of course, fencing. We take benefit from the highways in this area. Some of them were already fenced, but we also developed an important wire fence network in collaboration with French and Luxembourg colleagues, because we set up something like 300 kilometers of ASF fence in red lines on the map, but you don't see on this map the fence network from the neighboring countries. So the total fence network was something like 500 kilometers. This was important, of course, to limit the spread of the virus, to limit the exchanges between warble populations, but also it facilitated a lot the depopulation measures, because we can work on closed population, and when you are trying to depopulate, it is of course important to avoid any migration from one population to another, to be really efficient. You can see some pictures of the fence that we use. It was a 1.2 meter high wire fence, and we were able to install something like 6 kilometers of fence a day. So the fences were, we start to fence at the very beginning. So the first fence was finished at the end of October, after the outbreak in September. And of course, the important point is to try to depopulate in the surrounding area to avoid the virus could spread outside of the infected zone. So we had 2 main strategies. One inside of the infected zone, as shown on the graph here, where of course we stop any kind of activity when the first case was detected. So of course no hunting, but no feeding, no walking, no logging inside the forest. The only thing that we try to develop is trapping warble inside the infected zone, just to accelerate the elimination of warble inside. Then when the epidemic was over, we started with night shooting inside the infected zone, because the warble density was very low, and the only way to detect and try to cull them was at night, mainly on baiting sites, and these baiting sites had to be fitted with camera traps with a GSM connection, just to give an alert to the forest officers to go on site and to try to kill them. And finally, we decided to reopen hunting only 2 years after the outbreak. Of course, outside of the infected zone, the role of the hunters was very important, because the objective was a total depopulation of this area. So, of course, we promote hunting, intensive hunting, but we added some complementary methods of culling, such like trapping and night shooting, also by the authorities. So on these slides, you have a summary of the chronology of the number of WABO killed in the ASF management zone. You can see different colors corresponding to the different methods used to kill the WABO. So in yellow, the hunted ones, in gray, the trapped ones, and in, let's say, orange, something like that, or red, I don't know, it is the night shootings. Importantly is the quick and the intensive reaction when you have such outbreak. So you need to react very, very quickly, very intensively, because WABO, of course, is a species that is able to reproduce quite quickly. So if you do not hunt them or kill them very intensively from the beginning, you will never achieve any kind of results in the population. So you can see that hunters played an important role by organizing many driven hunts outside of the infected zone. But you can see that many WABO also have been trapped thanks to the work of the administration that provided traps, and sometimes hunters collaborated in trapping the animals. Otherwise, the administration had to do the job. So this is a map showing the distribution of the traps. You can see there were something like 170. Finally, inside the infected zone, as you can see, it was not possible to trap them because the virus was much more efficient than trapping, and finally it was a waste of time and money to try to trap inside the infected zone. But outside in the white zones, you can see that the size of the bullet corresponds to the number of WABO that have been trapped for each trap, and you can see that it's quite important numbers. In terms of efficiency, we estimated, but it is quite difficult to do so, that we spent something like 10 hours to trap one animal. Considering night shooting, so it was only allowed by the forest to the forest services. We have a lower efficiency because night shooting was mainly used to try to catch the last one inside the infected zone, so very low density inside the infected zone. The big advantage, it is quite flexible, and you can try to kill the animals where they are still living. And in terms of numbers, hunters did a great job because they killed a big part of the WABO in the white zone. But in terms of efficiency, using driven hunts, we estimated for 2019 that they use something like 60 hours to kill one WABO. Anyway, it is not the idea to compare the different methods. We think here that the combination of the three methods was very useful to achieve an objective of almost depopulation. Of course, there are still some WABO in this white zone, but the density has decreased drastically. So to get to have an overview of what happens in the different zone, we have compared the number of WABO that have been killed or found dead. We compared it with the back statistics of the previous hunting season for ASF occurred in 2017, and you can see that in the infected zone, the number of dead WABO doubled for the first year, and then it decreased because the virus killed a lot of them. In the white zone where there is no disease, we firstly increased the back statistics very importantly, and we did that during 2 years, in 2018 and 2019. And then, of course, because of the lower density and the lack of motivation of the hunters, because at this moment we already knew that the disease was over. So there was, of course, a lack of motivation going on killing wild boar in this area. And you can compare it with the statistics on in Wallonia, so the region where this disease occurred. Finally, we can have an idea of the efficiency of the population measures thanks to a camera trap network that has been installed in March 2019. So at this moment in the infected zone, most of the wild boar were already killed by the virus mainly. So you can see on the graph on the left the trend in wild boar occurrence detected by camera traps, starting quite low but going on decreasing, and on the right you can see the same trend, but from the white zone you can see that we start very high in terms of wild boar occurrences on the camera trap, but the decrease till May 2020 is very sharp, and we can consider that we reach a level of density in the white zone that is quite very low, and that probably did not allow the virus to go on and spread outside of the infected zone. Okay, that's finished from my side. Thank you.
Thank you. Thank you very much, Alan. And thank you for this beautiful presentation, as well as for accepting our invitations. And please transmit our congratulations to you and to all your team. You did a fantastic job, and it was wonderful. Now you stay with us because we're going to open the questions. There are a few questions already for the roundtable 3. So Paloma and Milos can be connected to us because we're going to answer this question. So Raquel, can you put the question already? Yeah, we're going to put the questions. I think there are questions, several questions for, well, the first one, let me put the first one. Let me put the first one so everybody can read it.
Yeah.
Oh, the first one, okay. First one is thanks. And they asked what marker genes are you using for the DIVA test? I think that probably this part it's a little reserved, but I don't know. Paloma, can you tell us this question, please?
Well, as a reporting gene, we have used several ones, and in one of the slides you can see that this one of them is GFP. But the other genes that we have deleted are confidential at this moment, so I can not say any additional information.
Yes, I imagine that. Thank you, Paloma. Thank you very much.
Thank you.
We're going to the second one. A more general question. First, wild boar, is there a common understanding in the European Union that one of the vaccine got a license in the EU levels, the applications can start on country level? Oh, this question, I think, I hope that Dr. Silvinas Elivicius, are you still with us? I think that you can help us to answer this question more properly. Oh, thank you, Silvinas, that you are here.
Yes, indeed. Yes, I can help with this one. In fact, again, this is a bit premature to discuss how the Asf vaccination could take place if we have an authorized vaccine. We don't have yet, let's say, the vaccine, authorized vaccine, and of course the conditions are not very clear. But we can say already that there is a specific legislation in place, also a horizontal legislation, and I was referring to animal health law in the EU, which provides for specific conditions for the use of veterinary medicinal products. So, of course, in case of African swine fever, the conditions will be provided in the specific legislation. and only under these specific conditions the vaccinations could take place. But I can assure you that this will be under a very, let's say, in-depth discussion with the member states that we are already having, and we are reflecting on it. There will be a specific delegated regulation for these purposes as well. Thank you.
Okay. Thank you. Thank you very much, Dr. Silvina. Thank you very much. So we're going to the next question. This is the Marcel, oh, the one. You moved too much, huh? No, it's here. The Marcel. We have a question, the Marcel, to Milos, and to Jose. Do you have now idea how to observe wild boar in Kenya during the field trial? I suppose that you will be cooperating and using the GPS system, sending some useful data that are needed in the field trial. Temperature measures, wild boar, or what is it possible to observe when? Okay, I can answer to the question from my side. I don't know later if Milos would like to add something. It's not going to be in wild boar, it's just in the bush pigs and in the facochero, and they are going to be not in an open area. It's going to be in a restricted and closed area where we want to be sure that these two species, the facochero and the bush pigs, are going to be inside one container, can be supporting after the vaccination against different virus isolate that we already have from Africa, and there are different big changes among them. So this is what we're going to do. So it's not going to be outside, it's not going to be where other animals can be. It's going to be very, very restricted research. What we want to be sure is if the vaccinations working in the facochero and in the bush pigs, and later, if they have a good immune response, we would like to see if these protections that the vaccine can give it to this animal have cross protection in relations with the different virus isolates that are circulating in Africa at this moment. So that is the idea of the project. Now, the other, Marcel, to certify the EMA recommendation, thanks.
No, it's the same.
What?
It's a continuation of the first one.
Oh, from the first question.
Yeah, but you have already answered.
Question to Milos.
Yes.
Or the what possible to observe when using tracking system to safety. And to certify them. Okay. I understand. It's the same question. Okay. In relations with the EMA recommendations, we are now to following this study, to do this study in Africa. We just started the conversations with the African authorities. So we still don't have the requirements. So we have first of all to know what the African people want. As I told you, it's going to be in a container, at an open situation. And of course, all the studies that we are doing here is under all the EMA requirements. So I think it's going to be no problem for that. But the important point at this moment is this is a very restricted experiment and in vitro situations only for facochero and for bush pigs to see if they are protected to the different virus isolates mainly circulating in that area of Africa. Now let's move. Humbert, what were causes of death of wild boar non-positive found during seizure, for example, in September 22, since there were more than 20 found per particular search?
Search, yes.
That's your,
yeah.
That's a land. It's for you.
Thank you. I think that yes, of course, the detection of carcasses was mainly correlated to the searching effort. So I think in September we had more people searching than in the previous weeks, probably. Anyway, I think that there are many wabo that died because of the virus, but they were not found quickly. So we discovered many bones during the last year that were probably wabo for most of them died from ASF, but they were not detected quickly. So because the area is quite huge, and anyway, it's even if we covered it 7 times, it was not possible to detect them, all of them, because of the detectability in the field and because of the availability of people to search for the carcasses. Of course, there are also other causes of deaths. It could be possible to have still some wabo that are car crushed, for example, but I guess, but I'm not sure that most of them, even if they were negative, because very old, they died because of the virus.
Thank you, Alan. Thank you very much. I think the next questions can be also for you or for Milos or for both.
Yes.
You keep the fence in Belgium. That's for you, Alan. Alan, that's for you.
Yes. Yeah. Which one? About the fences? That's it?
Yeah. Yeah. This is the first one we have to answer.
Okay, so okay, sorry. Yes, the fences, they are still in the field. They are still maintained until the end of March of this year. The idea is because we want to be careful and not to remove it too quickly. And we still need to think about the strategy for the next years, but we will not remove them too quickly. I think that we will keep a part of them installed in the field, at least a kind of skeleton of fences. Who knows? It could something could still happen, and we don't want to remove this tool too quickly. So I think we will remove the fences that are causing some operational problems for. I don't know, for farmers or for foresters, for example, but we will try to keep the main structure as long as we can.
Thank you, Alain. Thank you very much. I think the next question also can be answered by you.
Yes. Yeah, that is quite technical question, but we used special caliper 22 caliper to kill the wabo safely in the traps, because if you use classical hunting weapon, it is quite dangerous for the guy who will try to kill them. So it's a special caliper that's allowed to kill them safely.
Thank you, Alain. We have now a question for Milos and for you. What measures will you apply in areas affected by ASF that were steep, mountainous, and difficult to access, that will make it impossible to install effective fence to prevent the movements of the wild boar? That's an interesting question, Marta. Thank you.
Milos, your turn.
Okay, Milos, it's now your time.
I think that the mountains and the terrain would be advantage, so because many hunters expect that the boar are quite active in the spatial utilization. So, but we know that the boar are usually stable and have quite a small home range. So I think you could use this advantage and to define the infected area and to focus on the surrounding area to reduce the numbers as much as possible.
Thank you, Milos. The next question, is thanks very much is to you, Alan. Using how you have that for you too.
Yes. Yes, the idea is not to promote driven hunts, of course. First, we use that tool only outside of the infected zone. At the other side, of course, of the fences, that's really important. We will not start hunting without the fences, separating clearly between the infected zone with the wild zone. That's the first point. The second point, we use driven hunts because the most important is that hunters can use the tool they are used to. You will not train them with another more efficient tool that the one they are using usually. That's the really important to let them hunt like they do usually. And of course, hunting with dogs could be a problem. So that's the reason why in the beginning we forbid the use of dogs when hunters organized driven hunts. So they had to hunt without dogs. That was a problem for some of them. But after 6 months or 1 year, we allowed dogs again.
Thank you, Alan. The next one is probably for both of you. It's how do you destroy it, the carcass? So I don't know who would like to start.
Yes, just in one word, in the ASF management zone, so more than 1,000 hectares, 7,000 warbler, they were all sent to the rendering plant in order to be disposed.
Rendering, okay.
Yeah, and it was the same in Czech. So also in the infected zone, it's quite important to render also the hunted boar, so to reduce the risk of the transmission by the hunters.
Thank you, Milos. Thank you very much to both of you. This one is for Belgium. Alain, that's yours.
Yes. So the traps were quite large ones in order to try to capture the family in the same time. Important is the round shape, something like 50 square meters, and the round shape to avoid the corners and to avoid sorry for the dog, to avoid wobble getting hurt in the corners of the traps. And if you want, I can share the technical report that we wrote about the trapping in Belgium. It could be interesting for some of you. And what to do with the traps? So they were sent to the rendering plant. So about the compensation for landowners, no, because we tried in every case to install the fences on public areas. So the fence were installed along the national roads where the state is still the owner. So we didn't need to discuss with the landowners to build the fences.
Thank you very much. So the other question is interesting too. Do you pay any compensation to the land owner where you install the fence? That can be for both of you. So
yes,
can you answer? Thank you.
As I told, we use the state roads to build the fences, so we did not have to ask any kind of authorization from the owners because the state was the owner. So, but Milos, maybe it's different in your country.
No, it was the same. So we built the fences around the roads. So it was also the state property. So we didn't pay any compensation to the landowners. We of course pay to hunters and to the farmers for the another measures, but for that not.
Thank you to both of you. I think the next one also can be answered by both. Is how higher populations reduce the population of. That's a question for both of you, I guess.
It's a question for Milos because our wolf population is about 1 pack on the region. So There's no effect.
Yeah. Okay.
Yeah. Also in Czech, so at this moment we have more than 15 packs in Czech, but in the area where they live, so there is not so huge effect on the population size of boar. So the much more important is the hunting or culling for the reducing. We didn't recognize any reduction by the wolf in the area where they live. So at this moment.
Thank you, Milos. Thank you very much. Okay, have you had conflicts with the animals' right activities? A good coin.
From my side, we had no problems with animal rights activists. We had some trouble at the beginning between the public and the hunters, because hunters were supposed to introduce the wild boar illegally in the country, and that was considered as the reason from the introduction of ASF in our country. But of course, it is not the case. But we did not have to fight against activists. Milos, maybe, I don't know.
Yeah, also in Czech. So in relation with the ASF, there were no troubles with the activists.
Okay, thank you very much to both of you. We have now another question more in relation to it. You use drones or not use drones?
No, we didn't use drones with infrared. We just tried once, but anyway, it's not we don't have any experience with this. But anyway, I think that in the forested area, whatever the drone you are using, it's not possible to detect the carcasses because of the tree canopy. And infrared could help, but only during summer, I think, and when there's quite high temperature in the carcass during some days. But for example, in winter you have some heat coming from the carcass only during 24 hours, something like that. So I don't think it is useful, except in open areas like marshes or areas that are really difficult to reach by humans.
Thank you, Alan. Milos?
Yeah, maybe Czech. So we used the thermovision with the helicopter to inspect how many boar is remaining in the area approximately, to know how many boar is remaining at the end of the epidemic phase, to decide if we could start to hunt or not. So.
Okay. So we have for both the speaker again. Do you perhaps have an estimations? Well, you already mentioned a little about that. Can you add something about that question?
Yeah, if I could talk from Czech. So because the area were too small, so 150 square kilometers, so the numbers of boars are at the same levels as before. So, but
okay.
It's really a small area. So.
No, I just can say that the population is very, very low, and we don't know when we will achieve the same level as before, but estimate the population is still very difficult. We had to give numbers, and I think that we had something like a minimum number of between 50 and 100 wabo within the infected zone, so 600 square kilometers. So you make the calculation by yourself and you will see.
Okay. Milos, okay. We go to the next one. Milos, you want to say something?
So I don't know in detail of this topic, so about the impact of predators, but by the colleagues from Poland and also from the Baltic states, there were some studies published this year or last year about the possibility to spread the virus by the wolves, and I think that there were no cases that, for example, the virus were present in the feces of the wolves. So.
Okay, thank you very much. let's go to the next question. Is related with the training dogs. If you use, both of you use training dog or not?
We didn't use the trained dogs in Czech, so because it was at the beginning. So, but now the state administrative trained some dog for that. So,
okay.
We used a team of trained dogs, but they were trained after the epidemic was over. So, but it looks quite interesting. But you need so the dogs cannot work all day long. So you need many dogs, many trained dogs, and I think it could be interesting. But we use teams of 5 to 6 people, and that was very efficient. So the problem of dogs, you have to keep them trained, and now the outbreak is over. It is difficult to keep them trained. So that's the main problem for us.
Thank you. Thank you very much. We have also a question for both of you. Could you please share trap design and dimensions?
Yes, I can send you our report about trapping, and you will find every trap specifications inside.
so me too. We also have some methodology, so I can share it with the organizers, and the organizers could send it to the attendees.
So the people can send you an email, huh? And ask it. Yeah.
Yes, or for example, if you have the email list of the participants and send it to them, yes, I don't know.
Yes. Yes, we can supply you email of these participants. Yes. Okay. Very good. So let's go to the last question. Hello, about the thermal view. Do you use during the the night shooting?
Yes, we used both of them, thermal scope, but also light intensifier. Thermal scopes are better inside the forest, and the light intensifier is more is also very interesting in open landscapes, such like fields or pastures and so far.
Yeah, also in Czech. So there were some restrictions before the ASF came to Czech to use the night visions and thermoscopes. But from the time when the ASF entered the Czech Republic, so the hunters are allowed to use the thermovisions or thermoscopes, also the night vision, and from the last year also the silencers. And probably so they are able to hunt by the many type of hunts, also to shoot from the cars or during the harvest. So now the methods how to hunt is quite wide. So the hunters really could use, I think, everything what they can.
But I have to add that in peacetime, thermal scopes are totally forbidden in Belgium. Here, these scopes were used by the forest services and not by the hunters. They were not allowed to use them.
I see. So thank you very much to both of you. It was really very interesting, your presentations. And again, my congratulations, the congratulations of all staff for your wonderful job, and to also to accept the invitation. Thank you very much. So I think we finished already with the roundtable number 3. I think we finished also with this seminar. I would like to thank all of you to join us today. We have a lot of people today listen this topic. I appreciate very much to all of you that join us and stay with us all this time, and also for your questions, all the speakers for their presentations. And again, thank you very much. We are very, very happy to have the possibility of contact with you all. And as you know, you can always ask in us by email, by whatever you want, any questions that still has not made it today, but we're going to answer to all your questions even later. So thank you again to everybody, to all the speakers, to all the guest speakers, as well as to all of you, all the participants, to join us. We went from 170 and we was peak of 140. So there was a lot of people. So thank you very much. And you know, we are here always open to your questions and to any kind of things that you would like it from us. Thank you very much. Have a good day, everybody. Thank you to all the people, the translators. They also did a fantastic job. Thank you to Raquel for all the technical assistance. And thank you, everybody. I'm very happy, really, for this seminar. Thank you again. Goodbye. Bye-bye, my friends.
Bye. Thank you, everybody.
Thank you, Paloma.